Hi, good morning. Good morning, everyone. Hola, muy buenos días. I hope everyone is being situated. Buenos días, ¿cómo están todos? How's everyone doing this morning? Good. I think I need a little bit more energy. Where's that coffee? Eso. Muy bien, bienvenidos. Welcome, everyone. We're so excited to have all of you this morning. Welcome to 2023 Latinx Health Policy Summit, Regeneración. My name is Miriam Villarreal. I'm a news anchor for Telemundo 33, Telemundo 51 Fresno. We cover all the Sacramento region, all the way to Central Valley. So if you ever want to tune in, just watch Telemundo. And I'm so excited to be here, to be your MC for this day full of learning and collaboration. We hope you're very excited as well to join us this morning. Now, this year's summit is very special, not only because it's the first time that LCHC organizes this event back in person. So we're all happy that we're gathered here in person since COVID-19, since the pandemic hit, but also because LCHC is celebrating its Big 30. So it's a big celebration. 30 years advocating and helping our Latin communities here in California. So we're very happy for that 30-year anniversary. And we have a lot of things planned for you this morning. We have 4 panels that are going to be tackling on important issues regarding health in our Latin communities. So the first one is going to be about a diverse healthcare workforce. Second panel, data disaggregation. Third, Latinx mental health. And our last panel, Latinos and Latinas in the media. So after our panels, after this summit, the celebration continues because, as we mentioned, we're celebrating 30 years. So guess what? We have a double quinceañera reception. Who loves quinceañeras? Great. Well, after the summit, this celebration is at Elks Tower at 5:30 p.m. There's going to be food, dance, music, actually a special performance by Las Cafeteras. So I hope all of you are ready for this very exciting day. I hope all of you stick around after the summit and are able to join us in this celebration. Now, we also want to let you know that this event is also being live streamed on our, or LCHC's social media platforms through this camera. So thank you so much to all of you who are joining us through this platform. A message for our audience who is watching, our Spanish-speaking audience that's connected through social media platform. Si ustedes necesitan traducción, sepan que hay una opción, hay un enlace que usted puede requerir un intérprete y van a estar traduciendo esta sesión totalmente en vivo en español. Así que pueden hacer eso, tienen esa opción. This is also going to be translated for our Spanish-speaking audience who's watching through our social media platforms. All right, so I'm going to invite to the podium Paola Ilescas from LCHC for the land acknowledgement.
Good morning, everyone. Thank you, Miriam. And before we get started, we want to acknowledge that we are on indigenous land and we recognize the original peoples of this land, and we thank them for allowing us to be here today. We acknowledge them and we honor them. Thank you. Shkantiu.
Muy bien. Thank you so much, Paola, for those words. Now we're going to go ahead and get started. And for this, I'd like to welcome Dr. Cecia Aquino. She's the Executive Director of LCHC. And let me tell you about her because she's done amazing work. She holds a doctorate in public health from Harvard University. She also has a Master of Science in Global Medicine from the University of Southern California. For more than 3 years, Dr. Cecia Aquino served as Deputy Director of LCHC, where she strengthened organizational and financial development while advancing LCHC's internal and external strategy. She has also been focusing on consequential in expanding the team to include new women-led directorship roles and solidified LCHC's partnerships with California departments and agencies. So please welcome with a round of applause, Doctora Aquino.
¿Cómo está mi gente? Buenos días. Gracias, gracias. Wow, it is so good to see you here. Let's do another round of applause. ¿Se tomaron su cafecito? Yes, everybody's looking so good. What a blessing to be able to be here in person, sharing the space with you all. Thank you for taking the time. We know you are all busy, but really coming together in community to make this happen is what's going to help us advance health equity for our community. So welcome, bienvenidos. Let's get it started. If you all have not been to a summit before, I want to walk you through what this process looks like for us. You are in a very special place. This is powerful, being in the room. For LCHC, we have a very specific and intentional process to include community, to include all of us, all of our stakeholders in the policy-making process. And as you can see, we have that people-centered policy advocacy where it all starts, followed by that legislative and administrative action. And then we come together at the summit to report back. You might have seen our research in the back with community data, but also to have these really important conversations. And ultimately, these conversations are what shapes the Latinx health policy agenda the following year. So you are all part of the process. Where am I pointing to? There we go. I want to show you a powerful example of what we went through this past year. During our summit last year, we actually had a very dear member of our community, Odilia from Cielo. She's an amazing ED. And she came to the conversations during the policy summit, and she shared with us how important it was that we were intentional to include indigenous Mesoamerican communities in our policy conversations. We took that advice. We had those really hard conversations on how the Latinidad movement was affecting our indigenous communities. And so our team sat together and said, we need to do something about this. What policies can we put forth to make this happen? And so from that cultivation of the idea, we got together with really amazing partners, MICOP, Cielo, CBDIO, to make that work happen. And from there, our data disaggregation bill, SB 435, was born. Let me tell you what a journey it has been. We moved through the Senate, the Assembly, with unanimous support. Everybody knows that this is something that we need. Data disaggregation for Latinx subgroups and indigenous communities will actually help us understand the disparities better. We know that all of us experience our systems in different ways because of the way we look, our skin color, the language we speak. And we're Latinos, right? But that doesn't mean we're a monolith. We're very diverse. We speak different languages, and depending on the country of origin, where either we or our family members come from, we experience those systems differently. And so it is a very important process. Oh, let me go back. From there, and it's not the best news, but the governor did veto our bill. We are pushing back, but it is a hard process, right? To find that alignment. We know that we have the alignment with the Assembly and the Senate, but we're continuing to have those conversations. Our next step is actually we're moving on to admin advocacy, and we're setting up a curriculum where we'll be talking with different agencies and departments to move data disaggregation from the inside. And we have our wonderful Promotoras program, and the Promotoras will be leading this advocacy. So again, full circle, having community lead these conversations. Next. So, welcome to Regeneración. Why Regeneración? Regeneración, or regeneration, is a natural process of renewal and restoration after a disturbance or a really damaging event. We have all been through a pandemic. Can we take a second to just think about what we've been through? Let's take a deep breath. I want to say thank you to all of you for your resilience, your hard work, for surviving these past couple of years. It has been difficult, and we know that it has been even more difficult for our community members. For all of us here, we have the privilege to have a job, to be able to support our families, but there are many families in our community who are struggling, who were laid off, who didn't have food to put on the table the past couple of years, and they're still recovering. So for us, we're holding that balance really carefully, right? We want to acknowledge the pain that we've been through, but also infuse it with that hope that so characterizes our community. And so Regeneración is really thinking about that layer of beauty that comes after a very disastrous event. And today, we'll be talking about what policy ideas and solutions we need to move forward in order to ensure that the discrepancies that were highlighted and exacerbated by the pandemic can be addressed through policy in a sustainable manner. So, if you are not familiar with who LCHC is, our mission and vision is to address health inequities for Latinos across California. We are the leading statewide policy organization ensuring that Latinos can have equity across health outcomes. And the way that we do the work is through policy advocacy. So we believe in the balance of the acute addressal of issues, but also the sustainable and long-term solutions, making sure that we're thinking about the children of today never facing the issues that maybe you and I faced during childhood. Next. And we are very privileged and honored and proud to say that we translate community solutions into equitable policy and lasting systemic change. How do we do the work? We have 3 powerful external-facing departments: our legislative and administrative advocacy department, people power, and narrative change. And I would actually like to take a second to acknowledge my amazing team. Team, if you can please take a stand wherever you are. Come on, LCHC, let's do it. This beautiful group of people are desvelados, working hard to make sure that today can go perfectly well, but also just to advance health equity. And for all of us, it is a very personal issue. All of us have faced those disparities in different levels and are passionate to address those issues and move health equity forward. For us and our organization, it is solutions by Latinos for Latinos, from our staff to our board. So I would actually like to welcome our board. If you can please take a stand. Thank you so much for joining us. Our amazing and powerful board are part of our team. They bring their wisdom, their expertise to our work, and we appreciate you so much. Next. So, there are many jargon and definition that we'll throw out in public health, right? But just to set the stage, and for all of us to be on the same page today, we wanted to be very clear. And this is one of my favorite images. How many of you have read The Giving Tree? Yes, either for ourselves, our children. It's a very fun and interactive book, but I really like this. We live in broken systems, right? There is inequality in the way that we do the work, in the way that we live on the day-to-day basis. Through our work, we've been able to advance equality, right? Evenly distributed tools and assistance. So the system here is represented by the tree, as you all can see. Equality, we're seeing that we're giving both children the same level ladder, right? But because it is an unequal system, one child has better access to resources than the other. In the equity conversation, we're talking about customizing the tools to make sure that we identify and address that inequality, right? So we see the higher ladder, making sure that the other child can also access. What we are interested in is justice, moving from that equality to equity to justice conversation, fixing the systems to offer equal access to both tools and opportunities for our community. One back, perfect, thank you. Health justice, what is our definition here? Health justice is work that is community-led and seeks to eliminate the poverty, discrimination, and other forms of subordination that have prevented us, all of us here, our communities, from accessing resources such as healthcare, employment, and housing. Next. Racial justice. Racial justice is a vision and transformation of society to eliminate racial hierarchies and advance collective liberation where Black, Indigenous, Latinx, Asian Americans, Native Hawaiians, and Pacific Islanders in particular have the dignity, resources, power, and self-determination to fully thrive. We wanted to be very clear with our definitions today, because this is the only way that we're going to move this work forward. If we are clear with our intentions, if we set goals, right, that are achievable, that are moving the work forward, not just by setting up a DEI movement, right, but actually practicing what we preach. And all of us in a different spheres of influence have the power to advance racial and health justice. Next. So, just to set the stage today, I wanted to give us a Latinx community snapshot. Where are we as a community? So Latinos represent 40% of the California population. That's 16 million Latinos. We're a huge group. We are diverse, we're powerful members of the community, and we're continuing to grow. Latinos are more likely to be uninsured, and we have the highest Medi-Cal coverage. For Latinos, our fight against COVID isn't over. We know that acute cases keep growing, long COVID, the disparities that came about with socioeconomic status continue to affect our community. And then there were other acute issues that came up, as you remember, RSV, MPX. We saw in California a total of over 42,000 COVID-19 deaths. If we think about who that individual meant to their family, that is a lot more people that were impacted by those deaths. People that maybe now those families don't have someone to bring in that extra income, right? Maybe we see the number and we're numb to it now because we've been talking about this so long, but it's huge. This number is too large. Next. And then we saw over 4 million COVID-19 cases in California. Across the pandemic, Latinos were actually the group that experienced the largest loss of life expectancy by 3.05 years. That is concerning. We're talking about 3 years. Imagine if someone said to you, you have 3 years that you're losing now to spend with your family, your kids, your loved ones, your abuelita. What would you say? Is that fair? It's not, and that's why we do the work. Most recently, our community of those that were disenrolled in our June 2023 data with DHCS showed that 53.2% of Latinos were disenrolled from Medi-Cal. And this is through the work that is a natural process on a year-to-year basis in terms of Medi-Cal enrollment and making sure that that process goes well. But what is very concerning is that the majority of those that were disenrolled were Latinos. And as we just stated, for Latinos, we're not the same community before the pandemic. Those disparities were exacerbated. Our communities are fragile right now. We need to be intentional on how we are protecting them. And Medi-Cal is a life-saving program. And so we need to fight to make sure that that number goes to zero and that we're continuing to cover folks with that life-saving care. As I mentioned, our community is significantly different, quote unquote, post-pandemic, right? And our approach requires us to be a lot more intentional to address those disparities. I say that, and those are all facts. This is the data, what the data is showing us, right? But we gotta change the power narrative. There are some confusing power narratives out there. Oh, Latinos, pobrecitos, let's help them. No, we are extremely powerful. As you can see on the next slide, we not only bring that joyful, resilient, bold, driven, powerful energy on a day-to-day basis, but we have strong trust and communications networks. We saw it during COVID-19, right? If someone wasn't getting the vaccine, we called La Tia, who threw a chancla at them to go and get their vaccine, right? We know what works for our community. In 2020, the Latinx share of the US GDP was 2.8 trillion. Sit with that number, 2.8. If Latinos in the US were their own country, it would rank 5th largest economy in the world. That's huge. Maybe we should make our own country. That would be fun. In California, Latinos contribute $83 billion in taxes. Undocumented immigrant workers contribute $3.7 billion. And as we know, most undocumented community members are Latino. And we see $184 billion in spending power. So that's huge. We are powerful, and we need to own that, right? The justice that we're seeking, the justice that we want for our community is not just, oh, please give us more. No, this is what's fair. We are contributing. We are part of this beautiful economy that is California and our beautiful culture. We need to be responsive to that. Next. What do we do at LCHC? We take a public health approach. Next. I think most of us in this room are familiar with this framework, the Bar-High framework. When we talk about healthcare, for a very long time, we were just talking about the downstream factors. The risk behaviors, disease, mortality. It was easier to see, right? It was easier to talk about. We need to address those acute issues. There are many community members that are facing those issues on a day-to-day basis, and we need to do that. But how do we prevent our children of today from ever getting to the emergency room, right? How do we prevent them from ever getting diabetes or high blood pressure? How do we make sure that we're taking care of them? We need to think about those upstream factors. And I think all of us here are united in that belief. We need to address those social inequities, institutional inequities, and living condition issues through policy. Next. And so we talk about the very famous social determinants of health, right? We have nutrition, social and community context, housing, education, et cetera, et cetera. Today, I want to talk through a case study. Next. This is my story. Ceci Aquino, aquí para servirles. I was born in Guatemala. I lived there, yes, my chapina. I lived there for 10 years. And had a beautiful family, so fun, carne asadas on the weekend, very loving home. But when I was about 10 years old, we started seeing a lot of violence in the city. We used to live in La Capital. And a lot of little girls were being taken and sold into sex slavery. And my parents at the time had me, 2 sisters, and my mother was expecting another girl. They were afraid that one day we wouldn't come home. And so they decided to leave everything behind, their careers, their family, and immigrate to the US. We got here, we were undocumented. It was a very hard process to leave family, right? To leave those connections, that network. We didn't have a social security number, so my parents couldn't work. They were only able to work odd jobs, right? It was hard. Next. Like I mentioned, we had no extended family. We were starting from zero. What I did find, and what is beautiful, is the unity within our BIPOC community. I grew up in Gardena. That's where we moved. And a lot of us, children of color, were united by that poverty, dreams of wanting to better our family situation. Next. Economic stability. A family of six, we're making about $13,000 a year. Think about that. A family of six. It was rough. It was rough, but we were able to make it on a day-to-day basis because there were systems in place that were supporting us. Next. Housing. I can tell you about the fear that I felt when my family was evicted, not once, but twice, because of predatory rental practices. Our rent was capped, but new owners came in and they said, no, we need to charge you more. My parents didn't speak English well. We got evicted. I still remember my mother's call that day and said, Mija, we're going to be homeless. And it broke my heart. And I said, I don't want anyone to ever feel this fear ever again. We need to do something about this. Next. Oh. As we know, economic stability, the different social determinants of health, right, come together. We were evicted because of the lack of economic stability. We had no credit score. We were undocumented immigrants. So how are we going to show up anywhere to apply, right, for a new place? And we didn't have the money to pay the first and the last month. So these systemic barriers kept adding up, right? And this is what our families face on a day-to-day. And sometimes we are not aware of that because perhaps we're not going through that, right? And it's hard, but it's important that we remember that. Next. As I mentioned, there was food insecurity in the home. Next. The neighborhood. I lived on Rosecrans and Normandy, down the street from the Normandy Casino. I remember just how wild those streets were. We lived in a one-bedroom apartment. So when we first immigrated here, we lived in a mobile home with some friends, family friends. And I remember my mother, who was expecting, my two younger sisters and myself would sleep in the bed. My father would sleep on the floor. And this is what we did for about 8 months. We were finally able to get into a one-bedroom apartment, and we were in that apartment until my second year in college. This was our reality. This is what we knew. We were blessed that these difficult issues brought us together. We're a very close-knit family because of that. But again, I don't want to see a family of 6 living in a one-bedroom apartment. We deserve better. Contaminated water. We would open the faucet and see black water coming out. And then I remember when I was serving as a promotora, dentists who were not of the community would say, you should drink faucet water because it's fluoridated, it'll protect your teeth. And I said, clearly you don't live here because the water is brown. We are not drinking that water, right? One back. And then very unsafe community. I remember waking up to a SWAT team in front of our one-bedroom apartment because there was a murder across the street at the Pizza Hut. That is wild. This is trauma. We talk about what our communities face. All of that gets built up in our systems, right? Over time. And yes, we're resilient, and yes, we fight that. But why do our communities have to face this? This is unacceptable. Next. Education access and quality. Poor language access, right? We spoke Spanish. We had a hard time communicating. I had to pick up English very quickly and was, the family translator at all events. At our elementary school, I became the school translator because there were so many parents that needed that translation, right? And I do believe that we're placed in positions of helping others with purpose, with intention. And so I took that and I said, yes, let's translate for all the parents. And then the quality of our education. I love LAUSD. You know, I went through LAUSD through all my elementary, middle school, high school process, but the quality was not there, let's be honest. I got to college and quickly realized that there were others that were in private institutions receiving much better quality. That's not okay, right? We want our children to receive the best. And of course, we're all here to talk about health, lack to healthcare access, right? Uninsured, no access to preventive care. So what made a difference? And this is when we bring policy in, right? In 2012, DACA was passed, Deferred Action for Childhood Arrivals. President Obama signed an executive decision to move this forward. And for the first time ever, I was able to apply and have a social security number, work authorization, and a driver's license. For the first time ever, I wasn't afraid to share why I couldn't drive a car in high school. These little things, right, that make a difference. And all of a sudden, and this happened when I was in undergrad, all of a sudden I had hope. I didn't know what I was going to do with my degrees. I couldn't work, right? But when DACA came about, I was able to dream bigger and to say there is a solution to this. And it's because of the policy. So as you can see, that housing, immigration, economic stability, education access, all of those are impacted by one policy. Next. Nutrition. This wasn't around when I was growing up, but I know many of you here have been in the fight for the Food for All campaign, the Health for All campaign, and they would have been the perfect solution in terms of policy solutions to support both nutrition and healthcare access. Next. What did help is those acute solutions that we're talking about, WIC, food bank, mobile clinics at schools. And so you see this balance that is needed, right? The acute solutions to make sure that people have access today, but also the long term to make sure that we are building a sustainable system. During COVID-19, we saw relief policies come in that lifted folks out of poverty, expanded EITC, expanded child tax credit, housing vouchers, eviction prevention assistance. So we know what works. We have a perfect case study to show that when we provide that economic support for communities, it's going to lift them out of poverty. Poverty is a policy choice, and it's not okay. Next. As you can see, the American Rescue Plan alone reduced annual poverty during the pandemic by more than 12 million people, including 5.6 million children, which led to a reduction in child poverty of 56%, compared with poverty without that legislation. So we know what works. Let's do more of that. Next. So what are we doing here, right? We're breaking poverty cycles. Institutional bias, systemic racism, structural barriers, keep this loop going and going and going. We need to break that. And that's what all of us are here to do. So thank you for each of you and for the work that you do to break those poverty cycles. Next. I want to leave you with something today. This is a quote by Cesar Chavez. History will judge societies and governments and their institutions, not by how big they are or how well they serve the rich and the powerful, but by how effectively they respond to the needs of the poor. And I want to encourage each and every one of you today that our stories are powerful, that the experiences that we've been through have a purpose. I share my story not because it's special or unique, it's not. It's probably a variation of many of your stories here today. I share it because we need to dream bigger. We need to dream of a place where health equity is our culture, right? A culture of health. We need to build that. And all of us here have different levels, different spheres of privilege, of places where we can make a change. And I would like to leave this with you. If you have the power to hire someone, if you have the power to welcome new team members into your team, be intentional about it. Recruit folks who come from community. Pay them good salaries. By doing these changes, you are breaking those poverty cycles. So yes, let's continue to do the big picture work with policy. As we know, it takes time, but we also can take action on a day-to-day basis. I want to thank you all for your time today, and let's have an amazing day today. Thank you, folks.
Thank you so much to Dr. Aquino for sharing her story, telling us more about LCHC's work. And let's just give it up again for Dr. Aquino, all her amazing work. Thank you so much. Muchas gracias. Excuse me. Now we're so excited to have with us this morning an amazing keynote speaker. She's an actress who's been representing our Latino communities, and she's been representing our community in the big screen, in so many different shows, from Gentified to Vida, to producing and starring in the upcoming movie, Jenny, about la cantante mexicana, Jenny Rivera, and most recently in the Flamin' Hot movie. So please help me welcoming our keynote speaker, actress, producer, and advocate, Annie Gonzalez.
Thank you for that beautiful introduction. How y'all beautiful people doing? Yeah. Okay, Cecia, that was an amazing opening remarks, introducing us to what this I'm so excited. LCHC's Mental Health Summit is about. All of us here together, you guys. I'm so inspired looking at all of your beautiful faces here today. And I'm just so proud of the thoughtful theme of regeneración, regeneration. And I don't know a better group of people that know regeneration like Latinos and artists. Do y'all? For real. I was gonna stand at the podium, but I'm feeling the love. It is so nice to see your beautiful faces smiling back at me. All of us here today, I am so inspired by the work you do. It pushes me to continue to do the work that I do on screen, film, and television. I cannot do it without you guys. Having you guys as models is just monumental for me to go and show up and try and create the most accurate representation of what you guys are doing right here on the grounds. I'm gonna throw out some facts for y'all, just some fun facts. Did you know that most of the profitable companies that we look to today were built or birthed during a recession, a depression, or an economic crisis? UPS during the panic of 1907. We have Walt Disney during the market crash of 1929, Revlon during the Great Depression of 1932, because even though we were depressed and had no money, we still had to look good. You know what I'm saying? Meaning that most people start from a disadvantaged place, not knowing that they are disadvantaged, and they do just fine. In fact, they might even thrive. Take me, for instance. I am an only child to a single mom. I am 6th generation Chicana. Amen. You can say woohoo. That's right. We can be proud. We can celebrate our heritage and others at the same time. That's how we lift each other up. I was a latchkey kid. I was overweight for most of my life. I was bullied severely, and y'all, I did not know that I was disadvantaged. It was my baseline. It was my norm. I thought that most kids made themselves breakfast, lunch, and dinner, woke themselves up, put themselves to bed. I remember coming home from a sleepover and asking my mom why my friend's dad lived in the house. It was my norm. I didn't know that that was a disadvantage. And I look at the theme of regeneration, how Cecia had mentioned. It is the natural process of replacing or restoring anything damaged or missing. a term that I feel encapsulates our community. Regeneration, adversity, we don't just survive, but we thrive in the face of it. That's our superpower. And something that I like to practice a lot these days is stoicism. And stoicism reminds you to embrace challenges as opportunities for growth, knowing that every setback is a chance to refine your craft and your character. And truth be told, our history is filled with examples of resilience. I mean, look at Dolores Huerta, birthed during a farm workers' civil rights justice movement, thriving, inspiring all of us to stand up for the things that we believe in. Whether it's the stories of our ancestors or our own stories, they deserve to be told. And we know how to rebuild, rise, regenerate, and we do it with unparalleled spirit. We do it with joy. We do it with excitement because we know that the seeds that we plant today will bear fruit for the future of tomorrow. It's not always about us. And I'm so proud that we get to show up in that way. Y'all, I wrote some stuff down because I was nervous, okay? I was nervous because you guys are the ones doing the work, and I wanted to show up for y'all the way that y'all show up for me. You know, I will also say a lot of my inspired action to become an actress and to become a performer was birthed of the fact that coming from the hood, doing musical theater, being bullied, I never saw myself on screen. Yep, I didn't. And I remembered thinking, you know what? I'm what they're missing. Because I was sixth generation, because I had this disillusionment, because I was never raised with the idea that I couldn't because of my ethnic identity, that I couldn't because of my gender. My mom never instilled that in me. And it's because I had the privilege of being born on this side of the land, right? I went in thinking, I'm the missing link. I'm what everybody has been looking for. Now I went in, sadly to find out that there were a lot of people at the top that were scared. And they didn't know that we could exist outside of the stereotype. When I went in, a lot of what that's right, that's the real truth. And I think we end up believing that as well. I went in these auditioning rooms, and I remember watching film and TV with faces like mine being pissed off at the actors. Like, why do they keep doing this? But then, you know, the more you go and you see that it trickles from the top, oh, they're trying to make a living too. This is the only opportunity that they're allowed. And so I looked to the few exceptions to the rule that broke out from the monolith, from the stereotype, like John Leguizamo, like Rita Moreno, like Eva Longoria, like, you know, George Lopez, like all of these brilliant, beautiful actors, artists, entrepreneurs. And I took my courage from them. And I realized that my vulnerability was my superpower. And my courage was birthed from something that I had never seen before. And I was like, you know what? I believe that this little Mexican girl from East LA who grew up in a garage to a single mama would one day occupy your television screen, your film, and right here in front of you today. The path to success will definitely be riddled with obstacles, but these are the very things that make us stronger. They make us wiser. They make us faster. They give us more skill. Y'all, smooth waters do not make a skilled sailor. If it was easy, y'all would not be half as good at your job as you are. And that's the truth. What we also have to remember is to stay true to our values, to our authenticity, to our cultura. These are the foundations upon which success is built, our personal power. In the entertainment industry, it's easy to need the validation and to believe that that validation is the thing that's going to carry us. But that's false energy. The power that is wielded from within is likely the thing that has the most longevity. If it comes from your consciousness, it can't be taken from you. Whenever you're going through an uncomfortable experience, Like we all do, right? We're all at the forefront fighting for something different. We're at the forefront of change. It's not gonna be easy. But when you're there and someone hits you with some adversity, ask yourself, what am I trying to learn? What am I trying to do? What am I trying to challenge? Make it your superpower. You guys, it's not gonna be easy. It's gonna be hard, and it's gonna get harder because we are trying new and different things. You're going to make a lot of mistakes. There is joy in that. Find the joy in that. That is how we learn. I think sometimes we have to remember when we make a mistake and we learn from it and we move forward, we're making different mistakes. It is not the same mistake. So we have to be inspired by that. Oh, I'm reading an obstacle. How exciting. Another mountain to climb. Listen, that's the only way we're gonna get through this work, y'all. Are you kidding me? We have to. It sounds silly, right? And like, listen, on the way over here, I missed my flight. I'm talking to my little boo thing. He's like, you can only control what you control. And I'm like, you better shut the right now. I need to make this flight. But in reality, what can you control? All you can control is what you are doing, how you are showing up. If you are rooted in joy, if you are rooted in love, if you are rooted in light, you will attract more joy, more love, more light, more help, more authenticity. But now if you are going there in the fight and you're like, all I see is an obstacle. I'm looking at a problem and there's only a problem. Honey, you might be the problem. That's the real truth. If there's a big problem, guess what? There's a big solution. The obstacle is the way. Y'all, I wrote all this thinking I was gonna read from it, and I'm just here, so inspired by y'all. I have a quote for you that I came across recently that I hope will help give you guys some zhuzh. It is not the critic who counts, not the man who points out how the strong man stumbles or where the doer of deeds could have done them better. The credit belongs to the man who is actually in the arena, whose face is marred by dust and sweat and blood, who strives valiantly, who errs, who comes short again and again and again, because there is no effort without error. And whose shortcomings, but who does actually strive to do the deeds, who knows great enthusiasms, the great devotions, who spends himself in a worthy cause, who at best knows in the end the triumph of high achievement, and who at worst, if he fails, at least he fails while daring greatly, so that his place shall never be with those cold and timid souls who neither know victory nor defeat. That is by Theodore Roosevelt. All this to say, y'all, mistakes are our best friend. They're our greatest teacher. May we learn from the mistakes of the people that came before us. May we learn from the mistakes that we make today. And if we want to win big, we have to be willing to fail big. My whole life, I was told that I was too sensitive, that I was too loud, that I was too Mexican or not Mexican enough, that I was too short, I was too fat, I didn't speak enough Spanish. Why do I speak with a little Cholita accent? Because I'm from the hood, mind your business. And today, I get paid to cry on camera. I get the beautiful opportunity to yell at y'all and tell y'all how worthy you are and that what you're doing in this space doesn't only matter, but it's vital. It is vital to all of our existence to see our face from the White House to our television screens. You guys are the ones that are at the forefront of change. I am so proud of you, how you show up every day for yourselves, for your community, for people that you will not meet, that a lot of this legislation is then going to benefit. That's why I do the work that I do. That's why I've decided to start producing. That's why I pick so carefully the roles that I choose, because I understand that me walking through the street is not just me. I can't tell you how many times I've had women, young children, men from our community come up to me and say, thank you so much for doing the work that you do. Because of you, I'm able to go into my job and work twice as hard. I've had young women come up to me crying, telling me that they never felt beautiful until they saw me on their screen, because I reminded them of their tias, of their moms, of their sisters. So I need y'all. We need each other. We are working together, juntos. That's the only way that we can do this work together, building each other up, reminding each other how powerful we are, holding space when we make mistakes and not shaming or ridiculing, but having restorative justice. How can we learn together? How can I better support you? How can I help you? We are not a monolith. We have so many beautiful, unique stories to tell. Go courageously in the direction of your dreams. Do not let anyone's limiting beliefs about you bring you down. If you have a purpose that has been put upon your heart by Diosito, by the universe, by God, by consciousness, even if it's just birthed in your brain, you are meant to achieve that. Everything starts as an idea. This summit started off as an idea 30 years ago, and y'all are thriving. Y'all, this is some hard work. But you were chosen into these positions because you are capable. I was chosen because I am capable, and I'm courageous enough to believe that I can do it. I make so many mistakes, y'all. So many, as we all have. But look at us, we're still standing. Every mistake is an opportunity to look at that scar as a badge of honor. It didn't take me down. The way of which that tried to take me down that's pretty wild, but the way that I took it, kind of wilder. That is all, y'all. So as we move through this summit today, remember, y'all are not alone. We stand as one, but we come as many. I know that we are all working in different departments towards different things, and sometimes we feel like we're by ourselves, and it can be scary and terrifying. And when you are there, take a moment. Let's all actually just take a deep breath real quick. Everybody, one deep breath, breathe in, hold it, and let it go. Check in with your body. Where is your power sitting right now? Is it in your sacral? It is in your head? It is in your heart? Wherever it is, when you are met with adversity, remember where it's living right here, right now. You can bring yourself back to this moment. This is where your personal power belongs. With your people, for your people, by your people. Let's move through this summit with joy, with excitement, because we got each other. I'm so proud of you guys. Thank you so much for letting me be here and speak to you.
Muchas gracias. Muchas gracias a Annie Gonzalez for sharing those very inspiring words. Thank you. Inspiring words to pursue our dreams. And I love what she said, vulnerability is our superpower. So thank you so much, Annie, for being here. Now, before we move on to start our panels, I'd like to welcome now Director of Policy of LCHC, Mar Velez, who's going to guide us through an interactive activity, Nuestras Voces en Nuestra Salud, listening tour. Welcome so much. Welcome. nice to see everyone. I'm not going to take up too much of your time, but just want to thank you all for being here. And I really just want to take to heart what was just shared around the work that we're here to do. I know we're here to celebrate and spend time with each other, but we're also here to work, right? ¿Sí o no? They're like, no, no quiero trabajar. But all in service for our communities. And so you will find on your tables these amazing fact sheets that I'm going to ask Ariana, if she's in the room, to come up here and share a little bit about these community data fact sheets that we've worked on for the last year. She'll share first, and then I'll talk about the activity.
Thank you. Good morning, everyone. My name is Ariana Sagun, Senior Health Justice Fellow with LCHC, currently also working on my master's in public health with health policy concentration. Thank you. I had the privilege to facilitate the listening tour session this year alongside our regional partner organizations across different regions in the state of California, including the Bay Area, Sacramento, Central Valley, Central Coast, Orange County, Los Angeles, San Diego, and the Inland Empire. We hosted these sessions with about 16 to 20 participants where they were able to share their experiences within navigating the healthcare system. We wanted to understand, what does health reform mean for the Latinx population, and also understand what are the different health needs that are affecting their communities at this time. Some of those examples, we know they express, limitations within mental health services, affordable oral health care, but also addressing those social determinants of health, including housing affordability and food accessibility. I would also like to share that these spaces, the community members were really grateful to have an opportunity to share all their experiences and insights to really try to address those health disparities within their communities. So yes, these are the policy briefs that came out of those listening sessions, and we hope we were able to capture the community voices and insight to foster policy change in the state of California. If you have any questions about these briefs, I'll be here for answering anything. Thank you.
Thank you, Ariana, for all your work on these really amazing community fact sheets. So what you'll also find on your table is this worksheet. It has the table here, panel, questions, and policy solutions. And so what we're gonna ask you all to do today is that as you listen to our panelists, our conversations today, jot down some questions that you might have for the panelists, as well as any policy solutions that you brainstorm as you listen to these incredible conversations. Dr. Ceci Aquino, she projected here the policy roadmap that we employ here at LCHC, and your policy solution ideas might show up in our future policy agenda. You never know. So really appreciate all of the thought partnership that we will share today. Use your worksheets. We will collect them at the end of the summit. Okay, any questions? Okay, I get an applause too, right? Okay.
Muy bien, fuerte el aplauso para Mar. Please, another applause para Mar. Muchas gracias. All right, how is everyone doing? ¿Están listos? Are you guys ready to start with the first panel? Muy bien. Okay, so first panel, we have an amazing lineup of panelists. This panel is titled Somos Nosotros, Reimagining the Future of the Latinx Healthcare Workforce. And moderating this first panel this morning, we have Isabel Becerra. She's president and CEO of the Orange County Coalition of Community Health Centers, also known as the Coalition. So what is the Coalition? It's a membership organization made up of 27 community health centers that advocate and serve and help the most vulnerable patients, those who are either uninsured or underinsured. And as president and CEO of the Coalition, Isabel Becerra has led the organization to continue advancing for increased pipeline programs to the healthcare workforce through a lot of partnerships, very innovative partnerships and programs. So, and she's also a member, by the way, of the LCHC Board of Directors. So if you can please help me welcoming Isabel Becerra and the first panel.
Okay, can everybody hear me? Sorry for that awkwardness. This is my first time doing a panel in person in 3 years, right? Because we're all so used to doing this work via Zoom. So now I'm not looking at the screen, I'm actually looking at all of you. So welcome. What a powerful start to our day today. I don't know if I can top all of those stories, but we are going to get started with the business at hand. So thank you so much for that lovely introduction. The panel that we are going to be, that I'm going to be moderating today with my amazing colleagues is Somos Nosotros, Reimagining the Future of Latinx Healthcare Workforce. So in the panel, we're going to be bringing federal, state, and local community experts on the one central question that I know a lot of you in the spaces that you're in wonder often about in terms of the health workforce and the diversity in our space, the shortages that we've experienced. We were experiencing it before COVID, and we all know what happened during COVID, right? There was a mass exodus of a lot of our key staff, a lot of burnout. I think there's a new term of, and I'm going to get it wrong, but moral damage, moral hurt. People are exhausted of being in the space that they're in based on the workload that we're all experiencing. So before I go any further, we do have a great sponsor that supported our panel, so Altamed. Thank you so much for that sponsorship for our panel today. So again, a little bit of background. As we heard today with Cecia's presentation, 40% of our state of population are Latinos, yet only about 6% are physicians, and even less percent are female physicians. I think it's hovering around 2%. And that also includes other health professions like dentists, specialists, public health sector. Although in the public health sector, I understand women actually take up more of the positions, but there's still a shortage. There's still work to be done for us to continue to move the needle, because although I see a lot of my colleagues in that space, it's not fast enough and it's not enough, period. So we need to continue to do more. So today, again, we bring a great set of speakers, and I'm going to introduce them one by one. And I'm sorry, you're going to have to go through the awkward process, too, of miking yourself. So we're going to start with Angela Ramirez, Deputy Chief of Staff to Health and Human Services Secretary Javier Becerra. As she does that, I'm going to bring up Elia V. Gallardo, JD, Deputy Director of Chief Equity Officer for the California Department of Health Care Access and Information, better known as HCI, right? It used to be OSHPD, now it's HCI. Okay. Next up is Dr. Efrain Talamantes, Chief Operating Officer with Altamed Health Services. Ana Bolaños, Assistant Deputy Director of the Office of Health Equity for the California Department of Public Health. And last but not least, Lourdes Berniz, promotora with the Latino Coalition for Health of California. Welcome. Okay, so we're going to get started with the list of questions. The first question is for all of the panelists, and I'm trying to be your Latina Oprah, so or Cristina, yeah, thank you. Thank you. Okay, so from your perspectives, and each of you please answer the question, but before you do so, state your name, again, not your whole titles, but your name and your pronouns, please. So from your perspective, why is diversity needed in public health and in the systems that impact health? Angela?
I'll start.
Yes,
excellent.
please.
Buenos dias, good morning. My name is Angela Ramirez. My pronouns are she and her. If I can say at the top, thank you to our host. Thank you for having me. I'm originally from Sacramento, and this is such a homecoming to be here. To be amongst my community. Unlike our previous speaker, I don't get paid to cry on camera, so I'm going to keep it together. But why is diversity important in the health workforce and in this space? I'm going to hit really quickly, and happy to delve into more during Q&A. But briefly, it means better outcomes. I'm sure we've seen the stats. The one that is often burned in my brain is that Black doctors are better at recognizing pain in Black patients. So let that sink in for a minute about what that means. And we all have our own biases. That is just scientific fact. And it flows the other way. Patients are more likely to take in information and use it if they affiliate, and for whatever reason, with the person giving the advice, right? Trusted advisors. And it's something we all intuitively know, but the science bears it out. So why is it important? Because for as simple a reason as it means better outcomes. And in the aggregate, it also means better economics. We have billions of dollars lost because of health disparities due to racial and ethnic disparities. So it's the right thing to do for better outcomes. It's the right thing to do for our economy. And then the last thing I'll say, it's the right thing to do because if we're not addressing diversity in the healthcare workforce, it means certain populations, certain parts of this country will not have folks to do the treatment. So what we've seen, and as I've traveled the country with the secretary, I've seen this from New York to small towns in California and Oregon and everywhere in between. We hear stories about how if a doctor or a nurse is trained in a community, they're far more likely to stay there. And if a doctor or nurse is trained in the community they grew up in, guess what? They're far more likely to stay there. So this is not just a nice to do. This means that if you are trained in an underserved community that you're from, that's where the workforce is going to come from. And if you're not, the reverse is also true. It means we won't have a workforce in underserved communities. So it's not a nice to do. It's good for the economy. It literally means there will be workforces in certain towns, and it is better for outcomes.
Thank you. Elia.
So Elia Gallardo, Deputy Director of Legislative and Government Affairs at HCI and also Chief Equity Officer. I am going to hope, I do have to say that Angela actually said virtually everything that I was going to say, only probably better than I was going to, so I do want to appreciate that. And I am trying to get some slides up to just bring forward a different point, which is really about just equity and justice. So I was asked to present some information about what the health professions currently looks like for the Latino population. And I know these slides are small, but I'm gonna have you focus on the top two columns or the top two slides. That's all licensed Latino practitioners in about 12 professions that are outlined here that go across allied health, mid-level providers all the way to physicians and dentists. And then the line that goes down, that's the population, our representation. So just in an area of equity and justice, it doesn't make any sense to any one of us that look at this to see why our lines are not closer to our population line. The lighter blue is our recent licensees, which means there is progress being made, and that's sort of the hopeful message that I want to bring. I wanted to focus in a little bit about each of the areas of profession. This is our health professionals. So this is the first column where you see the red line. That's the Latino population, 40% of the population as we've talked about. And if you start looking at the other columns, those are our professions with the highest representation. Latinos are interested in being part of the healthcare delivery system, and you see high representation coming into the pathways where we need high school degrees, where you have the allied health professionals. This doesn't represent all the allied health professionals. It's missing anybody who doesn't get certified or licensed within the state, so our critical promotoras are not going to be part of this information, but this is our LVNs, and then you see RNs, NPs, and finally the physicians, which is at the lowest end. When you look at this and you heard what Angela said, we see a lot of Latinos that are not getting access to the kind of care that they need and deserve. This is the dental professions, and again, lots of interest, huge interest with our registered dental assistants, highest column above representation of our own population, and then it decreases significantly when you take into account some of the social, systemic racist and implicit biases that exist in the educational institutions throughout our health professions, where we're looking at creating more and those higher standards. So then you get to the dentist where you have, again, the lowest rate there. And I'm gonna just admit that this is the one that makes me the most hopeful. When I look, these are all mid-level providers. They all require a postgraduate degree. And you see our licensed clinical social workers with 30%. a very hopeful number. Our community wants to serve and they want to provide support to the members in the Latinx community. When you look at the associate clinical licensed social workers, those folks that have already met the postgraduate degree level and that are now looking to become licensed, they need 2,000 hours of on-the-job experience to become licensed. It's 50%. We make up 50% of that classification. So clearly there's something that's happening right in this sector, and that's what we need to be focusing on. So with that, I will pass it to our next.
Excellent. Good morning, everyone. Efrain Talamates, I'm the Chief Operations Officer at Ultimate. We're the largest federally qualified health center in the country. We're in Southern California, LA, Orange County. We serve about 500,000 patients, mostly Medi-Cal uninsured, and an increasing aging population for our Latino patients who are aging, and just so many needs, right? I'm an internist, internal medicine, primary care physician. My clinic's in Boyle Heights, right in the heart. And both not only at individual patient between us as providers or health care workforce, the need is so great, and it goes beyond language and culture. But we know that healthcare is broken. I think at a leadership level, there's so many opportunities to improve healthcare, and many of the greater solutions are coming from people in this room. Many respected mentors, people who've helped shape my career. But at a system level, there's a gap, a significant gap. Many folks in leadership in healthcare do not reflect not only our values, but they don't understand our communities. And so not only is it the right thing to do from the perspective of really impacting downstream that interaction relationship between doctor and it's a team sport, all the healthcare professionals, including our community health workers, to promotoras to be able to take care of our gente. But at a leadership level, there's a void that we need to fill in order to improve healthcare overall. And in primary care specifically, there's a growing need. I think that today what we see is obviously a lot of discussion around the gap and disparities between how many patients we have, how many physicians we have. Again, I really love the data you presented. There's a growing workforce that is much more reflective of our community, but they also need a lot of guidance, a lot of support. We also have to ensure that our communities understand what's available to them. And it's not just us in primary care. Then there's specialists, there's hospitals, right? So those are all great opportunities and different challenges, different levels where we as a community can come together. Really love the work that LCHC leads because it goes beyond the clinical walls. The clinical needs are great, but we also have to do a better job of going outside and doing a lot more prevention work. So really important in terms of diversity being represented across the state and the country. So thank you.
Hello, everyone. I'm really happy to be here. I've known Cecia now for a few years, even before she started working for the Latino Coalition. I'm Ana Olaños, and I'm the Assistant Deputy Director with the Office of Health Equity. And I identify myself as a bilingual, bicultural Latina. I'm also an immigrant. I'm one of 2 Assistant Deputy Directors with the California Department of Public Health. Just sit with that for a minute. Not a lot. There are 4,000 employees at the California Department of Public Health. 15% of the workforce at CDPH are identified as Hispanic or Latinx. We have a ways to go still. And I'll tell you why it's incredibly important that we have diversity in our workforce. I really believe that by creating diversity in the workforce, we're going to save more lives. Absolutely. Not just in the level of the healthcare system, but also in public health. We understand firsthand as immigrants or Latinos what it's like to be discriminated, what it's like to be ignored. I know as a child that I had that experience, and I witnessed it with my parents. As they got older, I decided that I needed to go with them at a doctor's visits because they didn't speak the language that well. And the doctors often did not always understand our cultural norms and how we live. That's so important in order to be able to treat the patient, right? And so I decided it's important that I'm there in the room with them so then I could help be their advocate. And I really believe that as a result of that, both my parents lived to be past 87. It's really about being present for them. And as I said, I had that experience personally where a doctor told me to stop, that I was interrupting him because I was asking questions. And it turned out that I ended up having a very serious side effect to a medication. So I said, that's never gonna happen to someone in my family, and that's not gonna happen to others. So I think it's important. It's about really understanding what we experience, what our Latino population, and not just Latinos, but the people of color. And we also need to be representative of the communities that we serve at public health. We can really advocate for different policies, share resources with our communities, our community-based organizations, to really lift up the voices of our communities so then they can be advocates for themselves and empower themselves and lead healthier lives.
Thank you.
Gracias.
Can I get the question in Spanish, please?
Okay. La pregunta, Lourdes, es, en su opinión, ¿por qué cree que tiene que haber diversidad en la área de la salud pública? ¿Por qué tiene que tener los doctores o los profesionales que proveen la salud? ¿Por qué es importante que sean diversos? O sea, de la misma cultura, el mismo lenguaje. ¿Por qué es importante eso?
Gracias. Buenos días, mi nombre es Lourdes Bernis, soy promotora comunitaria de Los Ángeles, California. Voy a contarles mi historia en relación a la pregunta. Yo soy de Ecuador, soy dentista, graduada en mi país. Llego aquí a Estados Unidos y no pudo ni he podido ejercer mi profesión por el sistema.
Se me da pausa. Oh. Gracias. Hola, buenos días. Mi nombre es Lourdes Berniz y yo vengo aquí para platicar sobre... Oh my God. Yeah. The focus is real. The focus is real. Hi, everyone. Good morning. My name is Lourdes. At least we know you understand. Hi, everyone. Yeah. Good morning. Mi nombre es Lourdes Berniz. Oh my God, my name is Lourdes Berniz. I am a community health worker, and I immigrated from the country of. Usted migró de Ecuador, ¿verdad? I immigrated from the country of Ecuador, and there I was a dentist by profession, a career that I have not been able to complete here in the United States.
Bien. Pues bien, desde mi perspectiva, de mi experiencia, no he podido por el sistema ejercer mi profesión aquí en Estados Unidos, sobre todo en California, debido a que el sistema no nos ha incluido a los extranjeros que tenemos un título porque no tenemos la licencia para poder practicar aquí, sabiendo la necesidad que hay, sobre todo de lo que es médicos, odontólogos, abogados de las diferentes profesiones con las que cuenta una diversidad los hispanos, sobre todo con ese título que lo traemos, pero queda aquí debajo del hombro.
Many folks that also experience the same thing. They could have been doctors, lawyers, other professions in their native countries cannot complete their careers here in the United States. And sometimes they have their careers or their titles under their shoulders.
Sabemos que hay una escasez muy grande, sobre todo por lo que es la conexión entre el profesional como el dentista. El dentista hispano se conecta con la comunidad hispana con su mismo idioma, con su misma cultura, con sus mismas costumbres, con su misma empatía. Pero el sistema nos tiene cerrada la puerta.
The system closes the doors to folks with these careers that have, been native to other countries and are now coming to the United States. These folks are able to compassionately care for their patients. Also, they know the country of origin, the languages firsthand, and it serves a great disservice for them not to be able to exercise their careers here.
Una de las ideas que quiero dejar en pólizas es que nos den la oportunidad a los profesionales extranjeros para que nos incluyan y que en el futuro más inmediato nos den o nos ayuden con una licencia. Incluso eso podría bajar hasta la data de la atención médica, que está muy elevada porque no hay médicos, no hay odontólogos, no hay ahorita el capital humano que podríamos llenar ese espacio o ese vacío nosotros los profesionales extranjeros.
Currently, there are no folks that would be able to complete or fill those gaps in needs of medical assistance. And we need a pathway for folks that have been naturalized in their countries and have created careers in their countries to be able to have those same abilities to have those careers here. If it's a doctor, if it's an odontologist, if it's a lawyer, they should be able or have a pathway to also be able to have those careers here in the United States.
Gracias.
Thank you.
Gracias por contestar. So the theme that I heard today among all of the speakers is, if we really want to ensure quality health outcomes for our communities, as we would for any community, then we need to be able to have providers that are able to identify with the communities they're serving, understand their backgrounds, cultural, linguistics, meet them where they're at, if you will. And so I think I see that thread. And, Lourdes brought up, I think, an innovative way for us to start to address that healthcare shortage, because we know that there are a lot of professionals in this country that are physicians, dentists, of all professions, that are not exercising in their profession, or they're doing other work, and we're missing out on their expertise. We're missing out on that cultural competence that we often talk about that we need for our communities, because we don't have that pathway. So I think we're going to talk about that policy impact a little bit later, but thank you all for answering that question. It was great to hear your perspective. So now I'm going to go into specific questions for each of our panelists, and I'm going to start with Angela. So Angela, as you and our audience know, the recent Supreme Court decision to no longer use race or policies like affirmative action that use race as a means to ensure people from different backgrounds have equal opportunities to pursue professions, and like healthcare professions, it's been stalled by the Supreme Court decision. What is Secretary Becerra and the Biden administration doing to ensure that Latinx and other communities of color continue to move forward and advance diversity within our healthcare workforce and related industries?
Thank you. I really appreciate the question. Immediately before I was at HHS, I was at the White House working directly for the president, and I can say it comes from the top. From the earliest days of the administration, he executed multiple executive orders related to equity and the importance of diversity. And we would say day in and day out at the White House, and we say it day in and day out at HHS, that equity is embedded in everything we do. We, of course, follow the law. We have a whole team that reviews and scrubs the things that we're doing, but there are definite paths forward. And I wanted to say at the top that the key thing is to say it out loud, what your goals are, so that you know where you're driving towards. And thanks to President Biden and the leadership of Secretary Becerra, they say it out loud and we know where we're driving. The second piece I wanted to highlight are the programs that we have. The reality, and I love the slide deck, and it actually hit on, I feel like we somehow co-presented together.
It's nice,
kind of amazing. The slide that you had where you talked about interest in kind of the different spaces, if you think about the numbers that we have, and now someone's going to bring this up. This isn't, I wish my own life worked this well.
You know, I just snap a finger and say,
the reality is our community is increasingly, is getting larger and larger. So as long as we are opening these pipelines, as long as we are working through retention to make sure we don't lose the folks we have, and as long as we are elevating programs that we already have for career advancement so folks can continue to progress, we will actually be in a better space. I will highlight a couple of our programs, but know that at HHS we have hundreds of them. And one of our administrators and I are co-chairing the HHS Health Workforce Initiative. And a big piece of this, there go my notes, a big piece of this is braiding together the hundreds of programs that we have, but I'll highlight two of them. The first has been around for 50 years. And I emphasize 50 years because this is something, this is not a flash in the pan idea, but for 50 years we've had the National Health Service Corps. And this is a program where people can apply to be a doc or a nurse in an underserved community. And in exchange, they will get not just scholarships, but also assistance with loan repayment. Because again, it's not enough to just get folks into the pipeline, we also have to retain them, hence the retention component of loan repayment. Another program I'll highlight that has been in practice for a while is the Nurse Workforce Diversity Program. This is a program that takes nursing students, meets them, as you said, where they are, and provides a spectrum of support, from mental health support to scholarship loan repayment and everything in between. And so I think, you know, we have these realities of the law that we need to follow, but if we're putting out up top what our goals are, if we are following the law carefully while using the programs we've had in some cases for a long time, being innovative about new ways to get there, I think we have a real shot at making some real improvements. And I'll give you one story, if I can get 30 more seconds, I promise. The secretary and I kicked off this tour down the road in Oakland at Samuel Merritt. And the day we met someone, her name was Yesenia, and she had just graduated. It was literally the day after she had graduated nursing school. And she was so excited and happy to be a brand new nurse. And we asked her, the secretary asked her, what got you through this? Why were you able to make it? And she said two things. She said, first, the love and support of her family. And second, she said the HRSA, which is a part of HHS, nursing program. And I didn't ask her to prioritize, right? I suppose family first. But she talked about, again, the spectrum of services, that it was about her not just getting support financially, but also the mentorship that she got, the connection she made with future employers, and the mental health support she got throughout when times got hard. So again, we of course, the times are always changing. We are always working to adjust. But I'm really excited about the programs we have and the new programs to come. And we need more Yesenias who are going to take advantage of these programs. So that is my ask to folks here today, to look at the stuff that we have and think about how it can apply to you. I'm sure we're fine, right?
Yeah. I wonder.
Someone will tell us if we're not. Thank you, Angela. I think that's a great response, and I think also an example of the justice slide we saw earlier about what we needed to give Yesenia at the time and the future Yesenias was not just the funding or the access, but that mentorship, because she needed that at that moment to be able to progress and successfully complete her program. Thank you for that. So Elliot, actually you got a head start on us and you gave us your level setting with the data. And so this next question will be easier for you. What is being done and what is left to do in order for the California systems, all involved, to intentionally recruit Latino workforce representatives in our state?
So I'm going to start by just stating our mission and then what we do to try to address the question. So HCI is, our mission is to provide equitable and affordable health care through resilient facilities, actionable information, and the workforce, the healthcare workforce that every community needs. So focusing on that workforce that every community needs, we have 3 goals that we work to and that we really try to use the lens to make sure that every initiative that we work on tries to address these 3 goals. The first is to have our healthcare workforce reflect the diversity and language concordance of the state of California. The second is to really build that Medi-Cal workforce, the workforce that's specifically dedicated to the Medi-Cal population. And then the third is that we want to address those historic workforce shortages that have just gotten more dramatic with the pandemic, as Isabel mentioned. So those are the 3 things that we're doing. And I will say that the biggest barrier in doing the work that we're doing is actually one of the things that you referenced, it isn't the Supreme Court decision, because unfortunately in California, we already had Proposition 209 that inhibited us from being able to use race specifically as one of the factors in our public education system. All the decision did was now extend it to the private sector, so the private schools out there. And the reason that I call that a barrier is if you looked at Octavio's gone, but if you looked at the charts that I provided, thank you. What the state is assuming when Proposition 209 happened is that, again, all of us were starting from an equal place. That's what it's assuming. It's not taking into account, I'm a first generation. My parents didn't speak English. They weren't active in school. They cared about it. They cared what we did, but they just couldn't interact with the school system the same way as people that didn't. I was smart, so I either got the implicit bias of people assuming that I wasn't, or I got the microaggression of people surprised that I was. So that's kind of what you experience when you're going through it. And yeah, many of us are able to work through it and make our way, and then there's other people that are not. And Prop 209 assumes that we didn't have that we don't experience that isn't part of the system, and that when we're going through our academic education and ultimately into our universities, that everything is the same. So race isn't a factor. Racism doesn't exist. Systemic racism doesn't exist. And unfortunately, the result is what you're seeing here. You see the impact by the lack of representation. So Proposition 209 and our ability to actually use race and race classifications is a huge barrier to the work that we're doing. So what do we do to try to get around it? I just want to say that is what we have to do, is just try to get around it. It's not as good, but it's what we have to do. So we have 3 different areas that we focus on. We do academic organizational grants, so we fund universities and schools to build programs, and I'll tell you what we do to try to make them build the programs in a way that's responsive to our communities. We also do loan repayment, scholarships, stipends to help the workforce. And I'll tell you how we target that workforce, because we can't use race classifications. We can't say you're a Latino, so you get more points. We absolutely can't do that. But we can say, oh, you speak Spanish. Let's give you more points. We can do that. So, and then we have our pipeline programs, the programs where we're trying to get to the folks early on to tell them, hey, this is an option for you. Health education is an option for you, and you should be looking at this and look at the benefits and look at what potentially we have to offer you. So those are the 3 things that we do. For our organizational grants, what we do, and I pulled one of the evaluation criteria for one of the grant programs just so that I make sure that I talk about this. So for those educational institutions, the CSUs, the UCs, the community colleges that are interested in getting some of our grants, we're going to give them points if the students that they serve speak Medi-Cal threshold languages. So we're going to give you points for that. We're going to give you points if who you employ are folks from underrepresented communities. So are the people that are your colleagues that students are going to see and that potentially act as mentors, are they part of underrepresented communities? Do you have strategies to promote student success? Do you have strategies to implement culturally responsive care training into your program's curriculum? So are you infusing your curriculum with how practitioners, all practitioners, can better respond to those cultural needs of their community? Do you have strategies to recruit and support students from underrepresented communities? Do you have mentorship programs? Are your teachers and your professors folks that speak to and look like the students that they serve? And then again, strategies, do you have strategies for culturally responsive care? So that's the kind of thing that we ask those universities to respond to us and tell us what they're doing, and we score them. So the folks that have those kinds of programs are gonna score higher, and in our competitive process are gonna do better. For students, we're more limited in what we can do because of Prop 209 and because of the restriction on race classification. So we will ask about, do you speak a Medi-Cal threshold language? Do you come from a disadvantaged background? And we're looking even closer at our own way of doing things and trying to see if there are other best practices that exist out there in the nation that we can incorporate into our program so that we can make sure that our scholarships, our loan repayment, and our stipends are going to students that, again, represent those 3 goals that I mentioned early on. And then with our pipeline programs, we absolutely funnel our pipeline programs to those programs that are in communities with underrepresented members in the community so that we can try to promote our workforce. So that's the activity that HCI is doing. And I do want to say this administration is very committed to this area. We've actually received billions in the B range to do this kind of work. So we're going to continue to do it and ask you guys to hold us accountable to it.
Thank you so much, Elia. So talk about looking at a barrier and saying, that's another mountain we can climb. How are we going to do that? So very creative ways to addressing the need without violating the new laws.
Yeah.
So thank you. Okay, the next question, actually it's a little bit out of order. It's going to go to Ana Bolaños. So Ana, what are the pathway programs that have been intentionally designed to increase the diversity of the public health workforce in California? And can you specifically share what those programs are, or the pathways are?
Absolutely, I can. I can speak on behalf of the California Department of Public Health. I think what's really important to mention that this is really a 2-prong approach. We're talking about recruiting externally to bring more people into public health, and also promoting our internal Latinx staff and help them to go into leadership roles as well. Not just stay at the same level, but really creating pathways for them to promote. I'm very fortunate actually to be working under this administration, not only under the governor's administration, but also working with Dr. Tomas Aragon, who is really the first Latino to lead this department, the largest public health department in the country. Well, we have many barriers that CDPH alone cannot address everything, right? But we are taking steps to recruit a diverse workforce. One of the things that we're doing is actually providing the staff internally with academic support, and they can apply for funds, not that dissimilar to HCI, but they can apply for stipends, so they can pursue either their degrees or to pursue graduate degrees or learning opportunities, professional opportunities to take some classes that might help them to promote, move upward. We're also creating what we call the California Pathway to Public Health Initiative that's been focused on increasing representation from historically underrepresented staff to gain exposure to public service at local health departments. So we're working closely with the public health departments through either a 13-month paid fellowship or a paid semester-long internship. I know that we, almost every year and throughout the year, we work with interns, usually from UC Davis, they're the local, and California State University, Sacramento. They come in into our different offices. We have several offices, we call them offices, divisions, and centers, and we place them throughout the department so they can get exposure and experience. And a lot of them are actually from diverse communities. And many of them have been bilingual Spanish speakers who then have decided to actually major in public health. And because of their experience at the Department of Public Health, oftentimes get hired as staff employees. And then externally, what we've done, I can tell you specifically, at the Office of Health Equity, we actually held webinars to recruit for many of the positions that we have at OHE. And so we had these webinars, and we reached out to all our community partners, which is pretty extensive. And they logged in, and we walked them through the different steps for the different classifications on how they can actually apply. And so we really are making it intentional to recruit from the communities that we're serving. We're also working internally to changing our duty statements and our job descriptions to really highlight that we're looking for people with lived experiences. You know, oftentimes, I was talking to the director's office, and I said, you know, we talk about equality and equity and all that, but we really need to also take into account not everybody has a degree. And the lived experience, if you think about your lived experience, whether it's 10 years, 20 years, 30 years, that's education. And we need to take that into account. It's important to hire someone from the LGBTQ community to do the work, to support the initiatives that we have at the Office of Health Equity, or the Latino community, or behavioral health. There's so much rich experience. And so we're actually taking that in. We're actually changing. So we're doing a systems transformation. Again, because we are a state department, we have to abide by some of the Cal HR rules, and you know that, right, Elia? So there are some limitations, but when we can push the box out a little bit, we do that. And so I'm really proud to be representing CDPH and to say that we are making gains and we are creating pathways for our both externally and internally to create a diverse workforce.
Thank you, Anna. I'm so glad you mentioned lived experience, because I know that given the workforce shortages that we're experiencing, imagine if we accounted for the lived experience that people come into our facilities with, and we counted that as education and experience. I think that we would eliminate at least half of the workforce issues that we have today. And we have Lourdes as an example, right? In her case, she's a professional in her own country, but she brings a lot of experience that I think we're going to get to in a little bit in terms of her work as a promotora. So thank you for mentioning that. So the next question is for Dr. Talamantes. He already mentioned that Altamed is the largest FQ in the country. And so kudos to you and the leadership there for that. I know there's a lot of wonderful work that's being done there. But I know that specifically you have a mentorship program called Mi Mentor. And so tell us how your mentorship program is increasing the number of Latinos in the healthcare workforce, and why pathway programs are essential in our community, and how hiring more Latinos and people with diverse backgrounds in general are actually leading to positive health outcomes in our communities.
Thank you for that question. So growing up, I think many of us shared a lot of shared experience around just the amount of barriers. One is that many of us live in communities where there isn't a real healthcare infrastructure. Obviously, growing up, I think now that we have community health centers and their growth, it's tremendous because there's a lot more opportunities for us, not only to volunteer, but to be able to actually be employed and get opportunities. So one thing that I noticed as I was going through medical school was that as a Latino male, the privilege I had, the amount of mentors I would see, and I often would give speeches or try to motivate young people to think about going to college and going to medical school. And it was pretty clear that everyone had some reason why they couldn't relate to me, right? Well, you're a male, you're Latino, oh, you're Mexican, oh, you're this, that. And so to me, it was very disheartening because I understood that that's the narrative that was accepted. And so started to work with a lot of wonderful people, a lot of mentors here actually in the room, and said, well, wait a minute, how do we bring visibility to the few of us who actually have made it, right? Whether getting into health professions, but really share those beautiful stories of someone who comes from a very different background, maybe not Mexicano, not Chicano, but be able to present those narratives. And that's where the concept of Mi Mentor came in. You can download the app. Started in 2012, very little funding. But it was this idea that, one, there were so many beautiful stories to share that our youth need to hear. And a lot of those youth I was finding in the community colleges. And so not only was I thinking, okay, how is mi mentor going to be able to share this narrative? What it started to highlight for me too was a systemic bias against community college students, many of them being underrepresented people of color. And the fact that they are traveling the longest distance to try to get to medical school, and they were being denied, right? And so through a lot of mentors started doing research to inform policy change, brought it all the way to the Association of American Medical Colleges, not only to say, hey, here's a cool app, you know, Mi Mentor, and here's a bunch of amazing stories, but here's the folks you're leaving out. And here's how the data is showing and bearing out that even if you had the same grades, GPA, MCAT, but you went to a community college, you were 10 to 20% less likely to get in. Why is that? Right? And I think about today in the work I do at a community health center where I see the struggle, even when our community health center, 80% of our workforce is from within a 5-mile radius. They reflect the community, whether they're in the front office, back office, nursing, providers. But we still have so many more needs, right? We're always 30, 50 providers short. Hundreds of nurses short. I mean, you name it, behavioral health, dentistry, we're always short because there's such a demand. And I think that what's been most powerful about mentoring or being able to be a clearinghouse for a lot of these programs, right? Because for me, it was always like, well, okay, this program selects 10 people. This one selects 20. This one selects, it's like drops in a bucket. How do we broadcast as many programs, not only in California, but throughout the whole country, put a face to it and say, hey, I've done it, I've completed it, this is how you can get through it. Here's the help not only getting in, but then how you're going to be successful and then taking the next step. So that's really the power of it. But the way this is what I would say is, and a lot of medical schools, most importantly UC Davis, has really shaped the way they think about admissions because of this work, to not just look at what do we think a medical student needs to be successful, but what does our community think, right? If you interview a patient today, right now, the most common patient presenting to any clinic, hospital, any system in California, what are they looking for, right? That's the power of having Mi Mentor, not only mentoring, but changing this narrative around who we want to be successful. It's not just the person who not only has the grades, but valuing a broader experience, a broader identity, a broader narrative that is so important to our patients. And that's the kind of folks we look for at Ultimate, right? Is those that are going to persist, because most of our patients are so challenged by the life circumstances that we can't do it alone. And we have to be persistent. And we want not only for you to take care of people in the clinic, but have a voice to be able to vote, to be able to transform healthcare for California. And that's a huge ask. Not many folks in healthcare want to do that, surprisingly, right? It's like, I just want to see my patient. But I think that's what we bring to the table when you think about those youth in Mi Mentor from all levels and mentors. They are bringing that kind of narrative as we need transformational change in health to improve the health of everyone, not just Latinos. We're not just pro-Latino, we're pro-equity for everyone here in this country and those coming that know that need us. So thank you for that.
Thank you, that's amazing. I want to hang on to your statement about not everybody wants to do this work. Right? We want to do this work. There's a lot of youth that want to do this work that don't know about Mi Mentor, don't know about the programs that you all talked about. And so I applaud your efforts for reaching out and not waiting for them to come to you, but you're going to them. They don't even know about what exists and what opportunities they have. So I have a time check, and I'm going to do my last question with Lourdes. Lourdes, ya nos comentó que es dentista en su país. Platíquenos sobre cómo usted convirtiéndose en una promotora. ¿Cómo es su experiencia y cómo usted encontró la manera de dar servicios de salud a su comunidad?
Gracias por la pregunta.
Thank you for the question.
La verdad que hay mucha similitud entre
There's a lot of similarities between
ser promotora,
being a promotora,
porque el área de la promotora es muy amplia, muy multifacética.
because the area of work of
Se
promotoras
direcciona
is very wide
exclusivamente a
We
conectar
exclusively
con
select
la comunidad.
and connect with the community.
El profesional de la salud
The
conecta
healthcare
con la
professional
comunidad también,
connects
con
to
su
the community
paciente.
through their patient.
Lo escucha
They listen to their patient.
y la promotora
The
hace lo
promotora
mismo.
does the same thing.
Me identifiqué con la comunidad
I
hispana
identify myself with
en
the
saber
Hispanic community,
cuáles eran sus necesidades.
and I ask, what are your needs?
Y entendí que las necesidades más grandes que hay es en el área de la salud.
I understand that the greatest need is in the
Por
area of
el
healthcare
idioma,
because of
hay
language,
falta de información en lo
lack of
que es los derechos
information
laborales,
with regard to labor rights.
en la fuerza laboral. Falta
within the
mucha
workforce.
información de
We need a
saber
lot of
cómo,
information
como promotora,
with how, as a
cómo voy a
promotora,
tener yo el derecho
how
a
can I have
saber
the
cuáles
right
son
to know
en el área de la fuerza laboral.
what my rights
También
are
otra
within the
situación
workforce.
muy importante
Another important
es
situation
el
is
desconocimiento que tienen
the lack of
en la
understanding
información
in the
en
information
todo lo que es inmigración.
regarding immigration.
Es una barrera muy grande
Huge
la inmigración
barrier,
en la comunidad.
Immigration within our community.
Y aparte de eso,
Aside
es
from
muy
that,
importante también en la educación,
it's very
que
important to have
tenemos
education.
muchos factores
We have a
que
lot of factors.
de pronto, como he escuchado aquí con los presentes,
For example, those
de
that I've
que
listened to with
hay
my fellow
oportunidades,
panelists, that there are, there
pero
are
muy
opportunities,
limitadas para el
but they're
promotor.
very limited for the promotores.
el promotor
The
tiene
promotor
que tener la oportunidad de incluirlo en el sistema de la fuerza laboral,
have an opportunity to be
también de
included
incluirlo
in the
en
healthcare
SCAE,
workforce.
incluirlo en el departamento de
Then
salud,
into the Department of Health.
porque el promotor
The
es
promotor
el que conecta
is the
con la
person that
comunidad
connects
cuando hay
with
una
the community
pandemia,
when there is a
el que está al
pandemic.
frente.
The promotor is at
Sí.
the forefront.
Y en ese caso,
In this case,
yo como promotora,
myself as a promotora
como dentista,
and as a dentist,
estaba a la par.
I was equal
Entonces,
to
no podía ejercer mi profesión, pero
a
estoy
physician,
ejerciendo la mejor
but I
profesión
couldn't
que puede
exercise
ser
my
el ser
profession.
promotor.
And so I can do only my
Es
best, which is to be a promoter.
Psicólogo porque escucha a la
I'm a
comunidad,
psychologist because I listen to the community.
es educador
I'm
porque
an
informa a la
educator because I
comunidad,
inform the community.
es comparte los recursos,
I
comparte
share
herramientas,
resources. I share tools.
es una profesión completa el
It's a
promotor.
profession. It's a true
Gracias.
profession. Thank you.
Y muchas gracias por darnos ese resumen, porque es cierto, sin los promotores de salud en nuestras comunidades, hubiera sido más desastroso la pandemia entre nuestra comunidad, porque iban a estar fuera de toda la información, los recursos.
Así es.
Y muchas gracias por su servicio.
Gracias a usted también.
Thank you to you as well.
You have to translate what you just said.
Oh, he does.
Oh, okay.
Oh, I can do it. So I thank Lourdes because, again, as a promotora, community health worker, she really did the heavy lifting and the brunt of the work during the pandemic, because they were the trusted entity. They were the ones that folks listened to, believed about the vaccine. They were the gateway to all the services that they wouldn't have known. And without promotores, I think the results would have been more disastrous in our community. So
Absolutely.
thank Lourdes for her work. And so with that, I want to thank all of the panelists. This was a wonderful discussion. I know that we just we got to the tip of the iceberg. There's a lot more to do, a lot more to talk about. But I don't know if we have time for questions. No? I'm sorry, we ran out of time. But thank you very much. And I'm sure that the panelists would be available throughout the day for questions that you may have. Thank you. Thank you, everyone.
It's nice to meet you too.
Thank you so much to our first panel, Somos Nosotros, Reimagining the Future of the Latinx Healthcare Workforce. So another round of applause, please. Thank you so much. Thank you for that very insightful conversation regarding the efforts to diversify the healthcare workforce, also inspiring our youth to follow a similar path. So thank you so much. Now it is time to take a quick break. It's lunchtime. I hope all of you are hungry, ready to eat. And before we move forward, I'm going to go ahead and give the mic to Marveles. She's going to give us some instructions for the food. Así que provecho para todos.
Okay. So I know that we're a little behind. And so with that, we do want to make sure that everybody gets fed. I know we've been sitting for a while, so.
Hello. We'll do a little organizer. If you can hear me, clap once. I need someone to clap. There you go. If you can hear me, clap twice. If you can hear me, clap times. Hey. Okay, but now we need to continue to keep your attention. I've come up a couple times this morning, but I didn't introduce myself. My name is Rita Medina. I'm the Deputy Director here at LCHC, and it's my first summit, so I'm really excited to be with everybody. I am going to bring up our wonderful MC who's going to lead us. I know there's been some shifts. Thank you so much for bearing with us. I hope everybody got their lunch. They're enjoying it. So what we're going to do is we're going to get back into our program. We're going to close out with a little bit of our lunch entertainment, and then we're going to move into our panel 2. So for panel 2, if you're the moderator or if you're on the panel, just please note that we'll be starting really shortly. And just be prepared. So make sure you eat your foods, get your drinks, and I'm going to toss it back to our wonderful MC.
Thank you so much. So how are the sandwiches? They're so good. Provecho. I hope everyone is enjoying their lunch so far. Now, I would really like to invite over here to the podium Luis Lopez Resendiz. He's an amazing poet, and he's going to go ahead and share and perform some of his original work. So if you can please help me with a round of applause. Luis Lopez Resendiz.
Thank you, gracias. Hi everyone, my name is Luis Lopez Resendiz. I am a Mixtec, un Mixteco. I'm gonna stand over here. Let me get my computer then. I had to have my writing in my computer, otherwise I can't memorize a lot of stuff. I just want to introduce myself. I am the Director of Programs with Comunidades Indígenas en Liderazgo, which is an indigenous nonprofit organization that is women-led, all indigenous. Everyone in our organization belongs to an indigenous community, and that is the work that we do, focusing or visibilizing the migration of indigenous migrants to this country, to the state, the contributions that we do, the importance of language. You know, after lunch, you're gonna see Aurora Pedro, who is also from Comunidades Indígenas en Liderazgo. She's gonna be talking, you know, sharing information on the second panel. And since we focus a lot on language access and try to bring language, I hope that all of you understand Spanish because my poems are gonna be in Spanish. I did not translate them. I often do not translate. If I write in Spanish, I keep them in Spanish. If I write in English, I keep them in English. For us, it's crucial to provide services to communities in a language that they best understand. And I do a lot of content on social media, so you know I target the specific Spanish-speaking populations. If I could speak my mother tongue in my home, the main language that is spoken is Unsabi, Mixteco, but I'm guessing nobody here is Mixteco other than myself, so unless there's another Mixtec here, so I'm not gonna be doing that in Mixteco. So I'm just gonna sit here. ¿Dónde está la cámara? Aquí está. A lot of the content that I do, or a lot of the poetry that I do is to touch back with, you know, my identity as a Mixtec person, as an indigenous migrant. I do not identify as Latino. I do not identify as Hispanic. Yes, I was born in Mexico, but in Mexico, growing up, I wasn't given the treatment as a normal Mexican, you know, because I come from an indigenous community. We were seen as less than a Mexican, so we were treated as savage Indians. So a lot of the content that I do is to highlight that. But also, a lot of the poetry that I write is to talk about the contributions that we do. You know, who in here is from Mexico, from Guatemala, from any other Central American country, from South America? I see a few hands. And I'm guessing a lot of you mandan remesas. How many of you send remesas? How many of you send money back to your loved ones? Sometimes we do it on a weekly basis. Sometimes we do it every 15 days, every time we get paid. I do send my remittances to my family who is back home because I understand, and many of you understand that, we migrated here, and the Dr. Aquino provided in the morning or earlier that, the economic contributions that many migrants do to this state, to having, California being the sixth largest economy of the world, and the contributions of many migrants are important, but also we carry the economic stability of different countries, or the countries where we come from. So I'm gonna start con un poema. I'm gonna now transition to Spanish. I wanted to apologize for those that don't speak Spanish, pero no lo voy a hacer. Okay. ¿Quién por aquí recuerda la primera vez que enviaron una remesa a sus seres queridos? ¿Quién recuerda ese sentir al saber que por fin sus seres queridos iban a tener una cena más completa? O un ingreso económico que antes no se tenía, una casa humilde, o quizás unos zapatos nuevos. Cuando se habla de migración y se confunde con ese discurso de que todo es bonito, con mariposas y toda la onda, me acuerdo de la primera vez que le mandé $20 a mi mamá. Tenía 13 años y me sentía como todo un adulto. Sentía que le regresaba un poco a mi mamá por todo el sacrificio y todas las enseñanzas que me había enseñado. Yo me fui de mi casa, o yo me fui de mi mamá a la edad de 12 años. Pero también sentía mucha tristeza porque tuvimos que separarnos para poder tener una vida diferente. Recuerdo que ganaba $80 a la semana y con eso quería construirle una casa. Con eso le quería dar una vida mejor, con eso le quería pagar por todo el sacrificio que ella había hecho por mí. Al mismo tiempo me sentía como todo un adulto independiente. Me compraba mis propias cosas. Y esto me da a entender que somos nosotros los migrantes los que cargamos con la economía de dos países, con la economía de la USA y con la economía del país de donde vinimos. Si algo merecemos los migrantes que estamos contribuyendo a esta economía es ese reconocimiento y que se nos respeten nuestros derechos, porque aquí estamos y no nos vamos. Thank you, gracias. At Cielo, we work with a lot of unaccompanied minors. We provide services on indigenous languages to a lot of unaccompanied minors. And that is the same story, which it always brings me back to when I first came to this country at the age of 12. I had to, when we talk of family separation, it always hits home because I had to be separated from my mother in order to come here to this country, and making sure that, at the age of 13, thinking of sending money back, and that is the same situation with a lot of unaccompanied minors. Many of them who are indigenous, we hear the story that, they had to earn their money and still pay their coyote and still send money back and still look out for the grandma, for the mother. So I think for us, when we think of, migration, it's not, just butterflies and this beautiful migration that is often talked about, but there's always a negative and a hurtful part of migration that we don't really like to talk about. But for me, it always hits home because those cases we see it on a daily basis, and that always, brings me back to my personal life. On, being 12, 13, working in construction, and trying to, send a little bit of that money back to home because, we understand that it helps a lot, and it helps to those that stayed behind. And I know la compañera Paola is going to be leading a conversation on mental health. My mom passed away on 2018. So since then, I started doing a lot of work on healing traumas that I carry, being separated from her, not being able to go back to her, not being able to go see a lot of my community because I'm still undocumented. I just had the privilege of going back, this past May to my hometown after 18 years, through advanced parole. And, with my community, as well as many other communities, talking about trauma is something that we don't talk about, especially within within the males, con los hombres. Es algo que no se quiere tocar, but it's crucial. It is important to talk about mental health, traumas, and finding ways to heal, because, you know, si no lo hacemos nosotros, nadie va a venir a hacerlo por nosotros, and there's a lot of things that, you know, it needs to heal. So I did write something about trauma and you know, trying to heal from, you know, my mom passing. Este se llama trauma, de hecho. Trauma, algo complejo de hablar, pero un arte si logras vencer el miedo y articular el dolor. Me gusta escuchar el silencio y por las noches apreciar la luna. Lo hice costumbre. Hacer el tiempo para escuchar a mis demonios y aprender de su dolor, tratar de sanar, pues. Me gusta saber que ya no me da miedo la soledad y que puedo apreciar la compañía sin tener que buscar formas de desaparecer. Lo hice muy seguido. Me gusta saber que ahora puedo viajar al pasado y escuchar a mi corazón latir mientras tejo un camino para mi futuro, mientras despido a mi mamá. Me gusta saber que hoy soy más fuerte que ayer y que ese niño que creció en un mundo distorsionado y confundido ahora puede sonreír e imaginar un mundo mejor. Uno donde la felicidad es la prioridad para hacer un camino bueno y uno donde mi mamá pueda descansar en paz. Voy a compartir otro. We're short on time, so I'm trying to do this quick too. I want to share something about the journey I took to my homeland. Yo regresé a San Jerónimo Progreso. My mom used to tell me I wasn't born in my hometown in the Mixtec region. I was born in Tijuana, Mexico. But my mom always reminded me for some reason that I was made in San Jerónimo Progreso, which for me it was like too much information, right? But it was crucial because after 30 years, you know, of being considered in San Jerónimo Progreso, which is in the middle of the Mixtec region, I was able to go back this past May, and be able to enjoy, you know, and realize why when we talk about migration, we don't, you know, for indigenous communities, a lot of these communities don't just woke up one day and said, you know, I'm just gonna go back, go to the United States. You know, the beauty, the motherland, the mountains, the fresh air, los pinos, los ríos, you know, we're straight up in the middle of the mountains, and, you know, I was disconnected from the internet in the Western world, so that was a beautiful experience. But in that journey, I realized that, you know, the real dreamers are those that are trying to keep us afloat, and those who we don't often think about when we talk about the DACA, the dreamers folks. You know, it is our parents who came here looking for those dreams. So este es, como dije, todo va a ser en español, entonces, ya no. Este dice así. Cuando se habla de DACA, los dreamers y la migración, tradicionalmente se habla de una narrativa latina, es decir, una comunidad mestiza o ladina. Y aunque son una parte esencial de esta gran comunidad, es necesario hablar de otras narrativas porque también existimos. Ya pasaron 11 años desde que nos dieron DACA y la historia es la misma. Una narrativa donde los verdaderos dreamers... Una nueva narrativa donde los verdaderos dreamers sean aquellos que siguen luchando por un futuro mejor para todas y todos. Es lo que necesitamos. Los dreamers son aquellos que luchan todos los días para mantener una familia a flote. Los dreamers son los vendedores ambulantes. Los dreamers son las señoras que salen a trabajar. Son los que mantienen una ciudad viva. Son las trabajadoras, los trabajadores, quienes caminaron tan lejos para cosechar nuestros sueños. Y quienes nos ven envejecer y aún se preocupan por nosotros, y quienes no tienen DACA. Para mí los dreamers son mi familia y mi comunidad, que cuando me preguntan sobre mi viaje con Advance Parole a la región mixteca, se enorgullecen, aún sabiendo que no hay una fecha exacta para cuando ellos vayan a poder regresar y experimentar ese viaje. Ellos aún no saben cuándo van a dejar la USA y aún así nos siguen preguntando sobre ese viaje que hicimos a la región mixteca. Son dreamers, pero también son tejedoras, tejedores, que con las memorias de las abuelas y las experiencias de la migración tejen espacios donde nos podemos reunir y crear un territorio imaginario, en colectivo, y hacer el tequio, para no estar solos y para no dejar o olvidar nunca nuestro pueblo. Esas son las narrativas que hacen falta. Eso es lo que debemos escuchar, de aquellas narrativas que fueron silenciadas y que también siguen siendo ignoradas. Just to give el tequio para muchas comunidades es ese trabajo comunal, donde tú haces trabajo sin recibir algo a cambio. Tequio is a form of, indigenous organization in the Mixtec region where you do something for the good of the community without expecting to receive something in return. You do that because that's how you resist this, because, that is what you have to do to be part of a community. And in my community, I have to do my tequio in order to be a citizen of the community where I come from. Lastly, voy a compartir dos más y ya les paso el micrófono a la compañera. We're about to hit Día de los Muertos. Día de los Muertos is around the corner. For me, that's always an important date because Día de los Muertos is when my mom comes back, when my grandmas come back. And as indigenous communities, we have a whole tradition that we had to follow. And for me, it's always, preparing myself to welcome them and, to remind myself that, I am not here alone, even though I am so far away from where she's resting. I know she will make her way to my home in a couple of days now. La primera helada del otoño anuncia su llegada. Por las mañanas un viento frío se manifiesta. Con el viento poco a poco llegan las memorias. Al mismo tiempo el fuego se mantiene prendido bajo las hojas del otoño mientras me abrazan sus recuerdos. Las memorias comienzan a brotar y la vida le da un camino para que los muertos pronto a casa regresen. La primera helada del otoño es un susurro que viene desde las cuevas del más allá. El frío acaricia mi cara y con el palpitar de mi ser se prende una llama que desde el inframundo me llama. No olvides abrir los portones, dice el viento. No olvides prender el incienso. No olvides tus responsabilidades. El frío abraza mi ser y me recuerda que en este camino no estoy solo, que ellos caminan conmigo. La primera helada del otoño está por llegar mientras yo le prendo el fuego al camino por donde mis muertos regresarán. And just as a reminder, don't forget, if you do believe in that there is something above us and there is a spirit world, it is important to keep our muertos alive, because once, I believe, and in my community there's a belief that they only died if you forget about them, and if you want to keep them with you and, be able to communicate with them, you have to keep them alive in your memories and in your hearts. Lastly, la última ya porque se nos acaba el tiempo, ¿eh? Ahí está. ¿No te pasa que cuando recuerdas a quienes se fueron de este mundo físico, lo primero que se viene a tu memoria es su voz? Yo me imagino como si el corazón fuera una bocina que menciona su nombre y ellos salen de su casa de las memorias y caminan con felicidad por toda la comunidad a responder tu llamada. Así como cuando hablamos con nosotros en el TR desde la USA. Las estrellas, las flores, los árboles y todo lo que nos rodea son testigos de cuando uno... Disculpen. Las estrellas, las flores, los árboles y todo lo que nos rodea son testigos de cuando uno deja de morir la esencia. Se acuerdan de que ellos fueron los que nos dieron luz. No se puede engañar a la tierra, no se puede engañar al viento, no se le pueden echar mentiras a los árboles. Lo que es claro para mí es que solo muere quien se olvida y que mientras sigamos manteniendo el fuego de su presencia encendido y utilizando las memorias para crecer ese fuego, ellos, nuestros muertos, seguirán caminando con nosotros en este gran pasaje que se llama vida. porque pronto nos vamos a reunir con ellos. Y para hacer eso tenemos que mantenerlos vivos para que no se olviden de quiénes somos. Préndeles una vela para que la luz sea el guía Préndeles una vela para que la luz sea la guía para que no te enredes en este camino y para que ellos puedan regresar. Y por favor, no te olvides de nuestros antepasados. Gracias. Thank you, everyone.
Muy bien, gracias Luis López Reséndiz por compartir tu talento con nosotros. Thank you so much. A Luis for sharing his talent with us, stories that many of us can identify with. Beautiful words. Muchas gracias. So we're going to go ahead and continue now with our second panel. Our second panel is about the lucha for data equity for Indigenous and Latinx health justice. We have a full panel as well. We have federal, state, and community leaders. And we're going to welcome back Mar Velez to moderate this panel. So a big round of applause, please.
Can we get the panelists to come up, please? Thank you, panelists. Sure. Hi, everyone. You know, these little microphones, they look cool, but I don't know if they're that cool. Okay. Okay. This should work. Okay, great. So, yeah, if we can get panelists to come up. And not sure if Octavio's in the room. Okay. Can we make sure that theirs are turned on. And as we get, why don't we sit a little bit closer? I think folks are. And as panelists get mic'd up, what I can do is go ahead and introduce our panel. So the name of our panel is The Lucha for Data Equity, Ensuring Indigenous and Latinx Health Justice. In this panel, we are bringing together our federal, state, and community leaders. And as Cecia mentioned earlier this morning, the impetus for data equity and data disaggregation actually did start about a year ago, last year, during the same event, the Latinx Health Policy Summit, where we had Odilia Romero, actually literally from the front lines. She was in front of City Hall in Los Angeles demanding for justice for Indigenous communities, given the awful leaked audio from the Los Angeles City Council that was absolutely insulting to Indigenous communities. And so we need representation, right? Latinos, Indigenous communities, we're not a monolith. And so I'm so excited for this panel, for all of you to share your wisdom on the work that you're doing to ensure data equity and data disaggregation for our communities. And before we continue, we want to thank the California Healthcare Foundation for graciously sponsoring this panel. Give them a round of applause, please. And so disaggregated data can play a critical role in the enhanced understanding of a specific population's health needs, trends, and preventable disparities. Moreover, rich, accurate, and of course anonymous data can assist local and state governments to allocate resources equitably and provide services in ways that are culturally and linguistically responsive. The Latino Coalition for a Healthy California embarked on an effort along with Indigenous-led organizations, Cielo, MECOP, and CBDIO, to sponsor Senate Bill 435, SB 435, authored by Senator Elena Gonzalez, the Latinx and Indigenous Disparities Reduction Act, which, as we heard, was unfortunately vetoed by our governor. However, data disaggregation is not just one bill, it is a movement. And so today we have an incredible set of speakers to talk to us about how we are going to be advancing this data equity movement. And so I'll just quickly present our panelists. We have Aurora Pedro, coordinator of the Indigenous Interpreters Program at Comunidades Indígenas en Liderazgo, or CIELO. Welcome, Aurora. We also have Sean Tan, Senior Public Administration Analyst at UCLA Center for Health Policy Research. Welcome, Sean. We also had Dorina Wong with the Asian Resources, Inc., and unfortunately, just due to timing, she cannot be with us right now. But just give it up for Dorina. She is such a leader in the data disag movement for our AAPI community. And then we also have Esteban Camarena. It's so nice to see you in person, Esteban. Field Manager, Census and Data Equity with the Leadership Conference. Welcome, Esteban. I know, packed panel, right? Packed panel. We also have Marco Midge, Undersecretary with the California Health and Human Services Agency. Welcome, Marco. And then, last but not least, Lila Burgos, Deputy Director with the UCLA Latino Politics and Policy Institute. Welcome to all of our panelists. Okay, so we're gonna do a lightning round. So this is just meant to get to know you a little bit better, your perspectives on how you are approaching data equity. If you can, when you answer, just restate your name, just the name, and your pronouns. And the question is, why is disaggregated data needed to advance health equity? And why don't we start over here with Marco?
Hi, everyone. Can you hear me okay?
I just hold it.
Okay, maybe I'll just hold it. Is this a little bit better? Okay, great. So I'm Marco Meach. I'm with the California Health and Human Services Agency. You know, this is a really important question, and I think fundamentally it's all about being able to see the people we're looking to serve within the programs. And so having deaggregated data and having the data at that granular level allows us to not only make sure that we're catering programs and services to better serve the needs of the people, but it also allows us to see really the unmet need. And I think that's a really important piece because if anything, what we learned during COVID is that it disproportionately impacted our brown and black communities. And as we embarked on the reopening and as we embarked on the efforts around vaccine administration and testing and all those other things, we really looked to anchor that in the data. And partly why we leveraged the equity measure is to say, we're going to invest in communities and we're going to push greater resources in underserved communities in order for us to make sure that we're really bringing up those communities in a holistic way. So fundamentally, that data is important for us to not only allocate resources, but it's also important for us to see people and understand how those programs are working on the ground.
Hi, everybody. My name is Sean Tan, pronouns he, him. At the center, we believe that data disaggregation is a vital component of data equity, as well as our advancing health equity. And so what I mean by that, I think for data disaggregation, it's a lot about looking into the populations that normally we don't see in the data. And I think that's vital in terms of our data equity, which is, you know, who gets to be surveyed, who gets to be part of, you know, the data sets, who has access to the data sets is very important to us, but also what can we do with the data and how can we use the data to influence policies so that we can address health disparities. And I think that's the most important part of our health equity lens, is looking into the various aspects of health disparities and also the underlying health disparities. And I think as we move forward with this conversation, we'll get to see more of why that matters.
Good afternoon, everybody. My name's Lila Burgos, pronouns she, her, ella, from the UCLA Latino Policy and Politics Institute. And for us, disaggregated data is a huge part of health equity and all equity, because anytime anyone here, and I would imagine this is most of you, have gone to where you are in a hall of power, from elected office to right here in a philanthropic organization, they say that we are data-driven. that we want to make decisions, we want to design, we want to implement interventions for health based on the data. And yet we know that if that data is not accurately disaggregated, you're not going to get the full story. You're not going to get the full picture. So for us, it's fundamental that data is disaggregated so you can actually see the diversity and the true story of what's happening in our communities, and then design accurate, effective interventions and policies.
Hi everyone, my name is Esteban Camarena, he, him, él. So I think a common theme that I'm seeing and have identified throughout this past year that I've been involved in this movement is that data disaggregation is about storytelling. And if you want to be part of that story, you need to be able to not only fill out these census or the ACS or whatever survey it is, but also see yourself in these forms as well. So making sure that we have surveys that people can reflect themselves in that. So that's the type of work that I'm specifically engaged in and modernizing and updating race and ethnicity standards for OMB. In order for people of color, people of different descents to be able to identify themselves. So for data disaggregation, the importance of it is that we are able to better see and identify inequities that exist and hopefully solve them. So data disaggregation for me gives communities of color, communities who are affected by inequities, the ability to advocate for themselves, because if we don't know that the problem exists, we can't come together and help solve this as a community together.
Yujan Dios, Aurora Pedro, they, she, ish. Hashka tinani yetun cholanti, Yujan Dios ka intala kulala li wach kulal. Hashka mung anehti chalish animati. So alil yechko kilwan anima drochonsti I drochonskono. Did anyone understand me? So I think going back to the importance of collecting accurate data and reflecting not only the community needs, is understanding how is that being collected, who's being represented. And if Indigenous people are constantly being lumped into a category that we ourselves don't identify with, for instance, like Latinx, our basic human rights are being violated. So this goes beyond data, unfortunately, in the world that we live in. If we don't exist in data, our human rights are violated. In our world, we are Indigenous, we identify the way that we identify. And unfortunately, if I were to fill out any form, there's no category for that. So how can we say that we're here for community needs if that doesn't exist on the paper? Not only have we experienced genocide throughout history, but we're currently experiencing that through data.
Wow, thank you so much. We are going to take a step back and start off very high level. And with that, I'm going to address this first question to Esteban, given that you are working on a few data disag items at the federal level. What is the federal conversation around data disaggregation right now? And you mentioned the census question. What can you tell us is happening with that?
So, since 1997, OMB's race and ethnicity standards haven't been updated. So that's almost, 25 plus years that these forms have not been updated in a way that is reflective of the changing demographics of the United States. So this past April, the OMB, the Office of Management and Budget, released an FRN, which is a Federal Register notice requesting feedback and comments on the proposed changes to OMB's Directive 15 on race and ethnicity standards. So through the work that we've been doing through coalition work, because a lot of this work depends and is contingent upon working together with a broad-based coalition. So we've worked with a diverse group of coalition organizations at the national level that are representative of the different communities that would benefit significantly from updating OMB's race ethnicity standards, such as the MENA population, so Middle Eastern North African population, as well as changing the format of the question from a two-part question to a single question, which research shows from the Census Bureau leads to better results and more accurately captured information of the country. So we've been working aggressively to not only advocate for these changes, but also start educating folks on what these changes would potentially mean. And unfortunately, SB 435 was vetoed on the premise that these changes are going to happen. And these are proposed changes. They're not official yet. So they should be announced in summer of 2024 and then face Congress. So we all know Congress is volatile, to put it lightly. But we've developed and we're still working and we're going to continue working on gathering support to implement these changes and then educating communities on how to complete the survey and how to best reflect, self-identify what they identify with through these forms.
So I have a lot of thoughts on that. So what I'm hearing you say is that obviously this is so needed to revamp this question. It's going to hopefully get us more accurate data. We know that our communities are very complex, but that even though there's this progress, that there's still several hurdles that we have to overcome in order to actually see those changes implemented. And so,
yeah, and I just want to add that the Census Bureau is underfunded, so that is also another factor. And so we're advocating to get a fully funded Census Bureau. And yeah, I'll just leave it at that.
Yeah. Okay, thank you so much. So, some federal perspective here. We're going to turn it over to Marco now for the state perspective. Marco, you did mention, all the lessons learned during COVID-19, but what did that also teach us about our data systems at the state of California? And what is the state currently doing to ensure that data equity is being advanced in our state?
Well, I mean, it taught us that we have very archaic systems that don't really work. They are super glued and duct taped, and they are not. They're not with the 21st century. We're having conversations globally around Gen AI, and we're like way light years behind. And so I think part of the conversation has been trying to figure out how do we get into the 21st century, to be very frank. The other thing is that we're data rich, but we're information poor. And what do I mean by that is we collect a lot of data, but we don't do anything with it. And so I think part of the question is how do you actually begin to utilize the data in a way that I think is really to the points that each of these folks made to really impact the community in a meaningful way. And so there's a few things that we've started within just the Health and Human Services Agency. One, we are embarking on an equity data standard effort within our organization. So it's first and foremost race and ethnicity data, but we're also looking at SOGI data as well as gender identity data and really thinking about how do all of our major programs, so Medicaid or Medi-Cal, CalFresh, CalWorks, WIC, begin to collect that information? And how do we standardize that so that it's all the same so that we can understand the population we're serving across those programs? Because what we know is that one family or one individual is not just getting CalFresh or CalWorks. They're also in Medi-Cal and WIC, and so we need to understand the holistic understanding of what's happening. We're also embarking on an effort to create an equity dashboard, and that will be coming out soon. And that process, I think, was less about understanding the gaps or the issues with regards to what we see in the data, but it was more about what data are we not collecting that we need to be collecting to really get to the true meaning of equity. And so there's a whole effort around, the question I asked the team was, what data do we not have that we need to have to better inform our decision making? And so that is kind of embarking now. And then the last thing really is thinking about how do we educate our providers and our partners on the ground and consumers about the meaning of them filling out the surveys or the information at the doctor's office or the WIC office. Because the reality is there are some people who are afraid to put down that they might be transgender or bisexual or a certain race because they don't know the consequences. But what we have to do is figure out a way to educate them about the importance of that in our understanding of their needs or their unmet needs. And so we're beginning to think about how do we educate our partners to equip them to have the conversation when the person comes into a welfare office or when the person comes to a doctor's office to say, why is it important for you to tell us or put that information down, and what are we going to do with it? I think public charge has really put fear in people, and for rightfully so. And so we are having to walk back and really bring people along with us to tell them this is what we're going to do with that information. And then we have to get into community and talk to people and let them know what this means too. And so all of those things combined, I think, are important. I think that we've had really productive conversations with federal HHS and with OMB to try to figure out how we align some of those efforts to not get out ahead. But the bar is too low at the federal level. We want to go above what the federal government is ultimately doing because we're California and we got to do things differently. And the diversity of our communities looks very different than the whole of the United States. And so those things have been really important for us.
Yeah, California is so diverse. We give it up for y'all for being so diverse. You know, I really appreciate you saying that, Marco, because that's how we feel, right? We are leaders. California is always so, you know, propping ourselves up. We're leaders, we're progressives. And yet there was this bill that was, you know, going to go above and beyond what the federal government was going to do. And yet, unfortunately, you know, our governor said no, ultimately. And so I think it was a huge missed opportunity for California to lead on this. And I was gonna direct a question to Dorina because, you know, I also want to acknowledge that we have made progress in this arena for our community. The AAPI community did pass a bill, AB 1726. Give it up for AB 1726. We are following in their footsteps. They have provided the blueprint for how to do this. And so they're currently, California is collecting and disaggregating data for AAPI communities. There's a report out, we can send it to you all. And so we want the same thing for the Latinx and Indigenous Mesoamerican community. But with that, given that, you know, the state, you know, isn't doing this right now, I want to direct the next question to Aurora, because in the absence of this kind of state effort, Cielo has embarked on, you've all embarked on your own data collection project to better understand the Mesoamerican community. Can you tell us why collecting specific data on Indigenous Mesoamericans is so important and how SB 435 can achieve health equity for your community?
Thank you. Yeah, during the pandemic, it was definitely a tough time for everyone. It was a very scary time. There was a lot of misinformation that was happening, and as we know in the Latinx community, there's also a lot of distrust in this information. So we can only imagine for the indigenous community, there actually wasn't any information being sent out to the communities. So Cielo created this information, and actually a lot of the times people think to send out information, it needs to be on flyers, on paper, on the internet. But if this information is not accessible to the community, it's not going to do any good. So Cielo started creating audios and videos to let the community know and share it among their family. It actually went from our headquarters in South Central LA all the way to back home, because as Luis had mentioned, everybody on the team has a community back home, whether it's Huehuetenango or Totonicapán in Guatemala or Oaxaca, Mexico. All throughout these countries, there are indigenous people being displaced forcefully. So when they make their way here, and if there's no information, accessible information, it's really just, it creates a whole nother level of barrier. So Cielo did create this information in indigenous languages such as Quiche, Acatecon, Anjobal, Mam, and Zapotec Mixteco, and that's just to name a few. And this created the foundations of a map. I'm not sure if this is, y'all can pull this up. So this is just information in LA, but imagine what we can do for California. And imagine how that would look if we led that throughout the 50 states. Because we do lead these types of movement. And this was created by community. And I know there's many times that, people will walk up to us. And I say this because I experience this every single day. And the default, if they look at me, in a space like this, right, is Spanish. But as an indigenous person, my first language is Zacateco and Anjobal. And if we're not speaking the same language, how can we understand each other? If we're not even attempting to do that, how can we make sure that community needs are being met? And how are we doing that? How are we collecting that? We need to understand here in California, there are indigenous organizations such as MICOP, CBDIO, Cielo that are leading these movements, and that we need to partner with because they are the experts. We can't build from the ground up. And as you see here, the map for LA, this represents 17 language families. That's not even including the language variants, which can be as different as Italian and Spanish. So even being able to understand how to read that, like what's the diversity in the community? Thank you.
Thank you, Aurora. Yeah, please hand it. And I just want to say it's been such a privilege to work with Cielo and to work with CBDIO and MICOP on SB 435. The bill would have also collected language data on 14 specific indigenous languages. So again, trying to ensure that our state has this information to be able to really provide services, provide information to this community. And so thank you so much, Aurora. We're gonna turn it over to our academic partners in crime, I'm gonna say. I'm gonna address this over to Sean. Sean, can you tell us, you work on a specific health information hub that I have accessed and find very useful. How did that hub start? And what have you been able to accomplish with the survey and information that you collect?
Sure. So I work at the California Health Interview Survey. It's the nation's largest state health survey that we have that's, representative of California's population. Oh, is that better? Or should I'll just hold there. Yeah. And so CHIS actually started in 2001 as to track health insurance and access to care in the state. But ever since CHIS has grown, we've added multiple questions, and a lot of them are on the social determinants of health. We also have questions on chronic conditions. But I think the cool part about CHIS is we have population data that we can see based on race and ethnicity. We can see and respondents who are part of the LGBTQ community. We're very fortunate that our data also collects immigration status, and so our respondents trust our data source in order to provide that information that has really, I think in our last iteration of our Ask CHIS platform, which is our public-facing platform where anybody can access that platform, you can actually tabulate over 10 million different variations of our questions and variables. And I think those have really helped communities identify specific health disparities that not a lot of surveys can do. One example that we have is, of course, for Native Hawaiian and Pacific Islanders during the COVID-19 pandemic. Because we had data disaggregation, we were able to show the disproportionate amount of NHPI folks that had contracted COVID, but also died from COVID. That wasn't showing in a lot of state surveys. And this was also similar for Filipino Americans, especially for healthcare workers, where Filipinos are only 3% of the healthcare workforce, but were 37%, I believe, of those that died from COVID-19 during the pandemic. So we can really see why data disaggregation matters in these contexts, and particularly for Latinx communities, we published multiple policy briefs as well as fact sheets ranging from mental health, gun violence. Like we recently just published how Latinx immigrants in California were one of the most fearful populations in terms of being a victim of gun violence. And that's something that is very salient right now in terms of public health research, but also we don't just keep it in the research hub, that this is about policy, this is about moving with community and making sure that communities involved. Our data sets and our questions that we ask in our surveys, they involve a lot of our community members, and none of this would have not been possible without the people around us. And I think we're fixated around data being this technology-driven entity, but it's really about the communities that make up the data that really is the power of our institutions and why we do what we can do right now.
Amazing, thank you so much. And again, I think CHIS, it's such a powerful tool. Again, we don't have that level of data, specific data for our communities, and literally you go in and you want to know about health insurance rates or education rates or multiple different things that you can search, and it's there, and it's pretty cool. I mean, okay, I'm not a data nerd, but I think it's cool. It's really, really fascinating. And so actually, we are so excited to have LPPI here because you all just released a Latino-specific data hub. So round of applause for this amazing new tool that we will have available. Obviously, never, we still need our state to collect our data, but while we continue that fight, Lila, can you tell us about the new the data hub and why it's so important that we have a tool like this specifically for Latinos?
Absolutely. So I'll start with what the why is first. So there's a lot of different advocacy and policy organizations in here. And I'm sure a few of you have been in the position I have where we're trying to use public data and disaggregate it ourselves to figure out what's the actual story in a specific municipality, a city. And that takes hours of piecing together data. It takes days. it takes technical expertise, and it is not easy to get an accurate accounting of what the situation is on the ground, even with public data, right? And so we know that that's a huge part, having accurate data of health equity, of any type of equity journey, and being able to, share and show these quantitative numbers of what the story is what oftentimes decision makers need. And not all of us have hours and days to pore over data sets. So what we did was we created the Latino Data Hub. And the Latino Data Hub has 10 issue areas. We use American Community Survey data. And in fact, right now, you guys can pull it up, latinodatahub.org on your phone. Lo tenemos en español también. Okay, so it is in English and in Spanish on the website. It's digital. You can create your own profile, create digital visualizations, download the data, and it has our 10 different issue areas which you can disaggregate by Latino descent group, race and ethnicity. You can drill down to the state level, to the county level, and look federally across the US on different issues for the Latino community. So it's very exciting. You all have flyers and stickers on your seats, and I very much encourage you to look at that data now.
Yes, thank you so much, Lila. So yes, on your tables you should have another fact sheet with the Latino Data Hub information. One follow-up question, Lila, is that does the Data Hub collect information on Indigenous Mesoamericans?
So right now, unfortunately, because we are using American Community Survey data, that data is not inclusive of the Mesoamerican indigenous communities. And today is a testament and continues to be of why we need to have SB 435 and why we need to ensure that the federal government does begin to collect this data. Because right now, we can't break it up. And we know that that is not inclusive. We're all grouped under Latinx, right? And that does not capture the multi-ethnic, the multiracial, all of the different language diversity we have in this room. So that's why we need to continue to push for more disaggregation at the state and federal level.
Awesome. Can we give a round of applause to our panelists, please? And I do want to provide just one last opportunity if you have any other comments, any other thoughts that you'd like to share before I turn it over to the audience for questions.
I just want to highlight the importance of the American Community Survey, which is one of the country's premier data source. And so the OMB updates will directly affect the American Community Survey. And we think about the census, and that happens every 10 years. And it's extremely important. But the American Community Survey is ongoing and takes place every year, every month. And a lot of people don't know about it. And so it's incumbent upon us and the organizations that we work with to uplift the importance of the ACS in order to help identify inequities that exist.
So how would someone fill out this, or do you have to go to the website?
It's random sampling, so there's about 3.5 million per year, and it's all scattered throughout the country. But,
okay, so
but if you get it, you get it, and complete it.
Okay, got it. In the mail?
In the mail.
Okay, check your mail. Anything else?
Awesome.
Yes.
So I think it's just important to recognize that we could either be working with communities and in order to be allies, just to work and understand like the different community, the diversity of the community, and as you said, without having the basis to collect the diversity of that, this ultimately it comes down to violation of human rights. And if we can't meet those needs, if we can't recognize indigeneity and our languages and the community needs that are there, then it is ultimately coming down to not honoring communities and their rights. So I think this is another reason why the veto of Bill 435 is just, honestly, it's very saddening, but at the end of the day, we're gonna continue to do this work because this language violence is not gonna end tomorrow, it's not gonna end in a week. then in order to do this work, we all have to like do it together.
Thank you, Aurora. Can we please give a round of applause to Aurora? And we're here with you. We're here with you. We will continue. So with that, do we have any questions from the audience? And maybe we can, okay. Yeah, the mic's right here.
Good afternoon. I'm John Aguirre. I'm the CEO of the Central California LGBTQ Collaborative, and we serve 5 counties, 2 in the Stanislaus County, Merced County, Calaveras, Tuolumne, and Mariposa. And we have 3 resource centers, or 3 pride centers that we have, one in Sonora, one in Merced, and one in Modesto. And the reason I say that is because some of our centers are really Latinx, Latino heavy, okay? And the one in Merced is actually called Somos Familia Valle Central, and it's focused on LGBT Latinx communities. The question I have, the SOGI data, it's not being collected, and we intersect with the Latino community. We have a lot of Latinos in that area that are part of the queer community. So a lot of counties don't even report that. So basically, we don't exist as queer or as Latinos. So how do you address that? And how are you planning to address that in the future for those of you who make policy or help with policy?
I'm happy to take that. I mean, I think to my comments earlier, I think you're spot on. I think one of the biggest frustrations that we had during COVID on the SOGI data was it wasn't collected at the local level. And so one component of what I shared with earlier is about how do we educate both our providers on the ground, our community partners, about why it's really important to have conversations as to why it is important to collect that information. And some of it is fear, and that rightfully so, we've got to get through that. But part of that is us being transparent about what we're doing with the information and how we're going to handle it. And then second, I think it's also important to have conversations with the individuals for them to understand why it is important for them to fill out the information. So when you do go to the doctor's office and they ask you all the gazillion questions, why it is really important for you to fill out the SOGI or gender identity data, because it allows us to aggregate it at the state level and have a better sense. And that's on all of us collectively to educate people about why that is so important. It's easy because it's optional in some instances to just kind of bypass it. And so we have to double down in thinking through how we educate both the individual and the entity or the provider. And I mean provider broadly here. It's not just a healthcare provider. It could be a promotore or a community health worker. It could be a social worker who might be working with somebody. It could even be a home visitor who might be part of a home visiting program. In each one of those instances, that's a touch point. That is a trusted messenger that can deliver the message around why filling that information is really important. So a lot more work in that space, and if folks do have ideas, we welcome them around ways in which we further engage in community around this topic so that people understand why it's important to fill that information out.
And just to add to that, at the federal level, there was a recent FRN that was released early this month. FRN is a Federal Register Notices, and it's required by law for every time that a new change is going to be added or any changes to the census or the ACS. So there's an FRN currently out collecting input from organizations to add the SOGI data question to the ACS and the census to start and start testing that in the coming year or so. So there's work, but there's more work always.
Thank you so much. And just to follow up with what Marco said, yeah, if you have any ideas, there's that worksheet that we put on the table, remember? Write down those ideas. What are some good ways, right? What are the messages that we need to be putting out there so that our community feels safe enough to provide some of that data so that we can use that to provide the resources that are needed? Okay, and I see another question.
Good afternoon. My name is Sarina Rodriguez. I'm a PhD student at UC Merced. My question specifically for Aurora, if that's okay? Yeah. So I plan to work with farm workers, farm worker health. I would like to do my research analyzing farm workers, not just as farm workers from an occupational lens, but as Indigenous people. I want to work with Indigenous identifying farm workers. I've done a lot of community-based work in the past, and the COVID-19 pandemic in particular, I've seen the struggle from organizations that are already basically tapped out. It's not just from community partners in Latino health, but also in Indigenous translation work. How can we, as universities, be supportive of equitable community engagement, of engaging the right people? For example, if my work with Indigenous farm workers, how can I make sure that I'm ethically doing this work with communities that are either at capacity, there's fear. I'm a university partner, I don't speak these languages either, so I would be relying on community partners that are extended possibly to capacity. Basically, how do I ethically move forward in research that tries to encourage more Indigenous voices without co-opting, without stretching people too thin, without having people I interview or people I talk to in the fields have fear, basically.
That's a big question. So I think going back to just doing work in the Indigenous community, there are already leaders there. There are already organizations there. And when doing work with Indigenous community, the number one thing that I've noticed that gets missed is budgeting for interpretation. Because if we can't even communicate from the start, anything that's collected is inaccurate. Even if we can answer yes, even if we can answer no, broken Spanish, a lot of that is, we would never input that. We would never, in English or Spanish, we wouldn't accept that information. So why do we do this to Indigenous communities? So I think first and foremost, I think it's just speaking and talking with Indigenous community leaders, organizers, honoring what their boundaries are, and really seeing what they see as the community needs, because a lot of times outside institutions will come in thinking, I'm gonna save this, or I'm gonna solve this problem here. When in reality, the community knows a lot of what the issues are. And really honoring their autonomy in that just goes a long way, and making sure that all communication, that we're honoring their rights to an interpreter, because if we're using this information, how does it go back to the community? So I think at the end of the day, just really listening and making sure that Indigenous communities are not being, no one's speaking for us. No one, we're not voiceless. There's many times that we're told that we're voiceless. No, we have a voice. We've been doing movements. And especially when it comes to academia, we know the history of extraction. So we just want to make sure that that type of work is really including voices and decisions by Indigenous community.
Speak that truth, yes. But also appreciate the question. I think that is also really important, that research institutions are asking themselves these questions before unintended consequences. I'm getting some signals that we need to wrap up, but I do just want to see if there's one more question.
Buenas tardes. My question is for some of the folks in halls of power. How are you all going to build trust with our comunidades around that data? Because it's not just having folks be informed on how to collect that data. There's a lot of mistrust. And even with that policy that y'all advocated for, there's trust to remedy there because that was not passed. So I would love to open it up to all folks, academia, halls of power. How are you all going to be building trust with our communities?
Not all at once.
I can start. At least for CHIS, like I said, like our questions are community driven, and we pre-test these questions with the community in mind. So every time there's a new question on CHIS, it's usually we have a random sample of individuals that we test these questions for to make sure there's understanding of this question. Our sampling strategies also, when we survey CHIS, we do push to web, but we do a telephone non-response. And so what that means is we do call participants. And so we do it in English, Spanish, Chinese, Vietnamese, Tagalog, or Filipino. And I think when it comes to our work with Native Hawaiian and Pacific Islanders, especially for me when I worked with our follow-on study, which is when we survey CHIS participants who identify as NHPI, every step of the way was involving community, from the research question to what the analysis might look like, towards the, is this analysis what's reflective of what the community is experiencing? We've done basically a community feedback where we present the data to the community first before anything else, before we even put it in a publication, so that we show that this is for the community and that this is, it tends to be in academia that's a lot of like publication machines because that's kind of like the game. But for us at the center, we really want to build and maintain that trust, and that the data you see at the center with CHIS is what the community wants and what the community can use in terms of their own initiatives, whether that's policy or even just community building.
Awesome, thank you. One last response from anyone?
Yeah, I mean, I think at the state level, I think it's a really good question, and I think it's multi-pronged. One, I think it's about getting deeper into community to build the relationships with folks, and being active listeners in that effort to fully understand kind of what people need. And then I think it's also important to create the sandbox for us to co-create and work together to understand what the data is actually telling us. When I earlier referenced the idea that we're data rich but information poor, I think we collect a lot of it, but we give it to the academics, no offense, but it's like 5 years later, we read it in the New England Journal of Medicine, and then it's too late to influence the policymaking process. And so part of what we're trying to do is create the sandbox where the data is there. We invite some trusted partners into that sandbox so that we are aggregating the data and analyzing the data together, and then going back into the community to say, does this really reflect, to your point, what is actually happening on the ground? Because the quantitative component is just one piece of the picture. The qualitative component sometimes is perhaps more important or equally important to the data, because not always will we get the true story in the data in itself. And so creating space for that type of environment where we have the ability to co-create is going to be really important moving forward for government in order for us to iterate and move quicker in adapting policies to reflect what the data and the qualitative and quantitative information is telling us.
Yes, thank you. All right, folks. Well, this wraps up panel 2, La Lucha for Data Equity. I want to thank our panelists. Give them a round of applause. And we look forward to continuing this work. We look forward to working with you, Marco, with our legislature, with our governor, to make sure that we pass legislation that will disaggregate the data for our community. So thank you so much. And I will pass it on to Miriam.
All right, thank you so much. Thank you to panel number 2 for this very insightful conversation, highlighting the importance of representing our communities through data. Now, before we move forward with the next panel, we do want to remind you that we still have some coffee. Please go ahead and grab some if you need to refresh yourself. I don't know, si quieren un cafecito, todavía tenemos café acá atrás if you guys would like to grab some coffee. Now, this next panel is also very important. We're going to go ahead and talk about mental health in our Latin communities. Now, what are some of the factors, some of those unique challenges, even what are those impacts that happened since COVID-19, since the pandemic hit on our Latin communities? So this next panel is titled Sanamente, the State of Latinx Mental Health. We have an amazing group of panelists as well. And this next panel is going to be moderated by Paola Ilescas, Program Senior Manager for LCHC.
All right, thank you, folks. Go ahead and grab some coffee as we set up, but I would like to invite panel 3 members to come up and we can get you set up. Thanks.
It doesn't have to hide and
Thank you. Okay. We're all set up, right? Awesome. All right, folks, sorry to cut it short, the break, but thank you so much, everyone, for sticking around. We're on panel 3 now. I'm really, really excited to have a few of the experts. Now, if everybody can come back from their coffee break, their water break, come take a seat. I know we needed a little bit of movement, so glad we got that in. All right. Okay, folks, we'll be starting now with panel 3. Thank you so much. This is the panel Sanamente, the State of Latinx Mental Health. I'm Paola Ilescas. I'm the Senior Program Manager here at LCHC. And I'd just like to thank the previous panel. I'm sure a lot of us got a lot of insights. I continue to encourage everyone to use their paper, write your questions down. We want to hear from you too, as well. We want to hear those questions, those comments. And also, thinking back on Luis Lopez Resendiz and his poem that he shared with us, it just brought to mind to me how our ancestors collectively builded and as resilient as they were, have brought us here in the present day today, right? And we're all here collectively also bringing solutions, ideas, talking about these very important things that affect and impact our health at the end of the day. So really recognizing those poems and how our personal stories are interweaved. So really want to thank Luis, even though he had just left. But with that being said, yeah, Sanamente, the state of Latinx mental health. So Sanamente, it's a little bit of play on words there, but Sanamente means healthily. And when we break that down, we have sana, which is healthy, health, and mente, which is mind. So we're talking about this today in mental health in general, what that means in our community, in our comunidad. Also, even though we have our own individual stories, there are also existing systemic barriers and challenges that are affecting us. And we see that whether that's with ourselves, our vecinos, our sisters, brothers, primos, primas, etc. We have seen how they have faced in those challenges and trying to overcome that. But I'm definitely excited to have our panelists here today. But before doing that, I'd like to thank Ocean and also HealthNet for sponsoring this panel. So a round of applause for them. Okay, so starting off with a few statistics and a few studies. And I want to, again, reiterate, right, these are statistics, these are numbers, but also, again, these are human beings. These are our family members, as I mentioned. These are vecinas, vecinos, folks who are trying to navigate these systems that are oftentimes very, very hard. A recent UCLA study reported that there was a significant unmet need for our comunidad in terms of mental health services and assistance. And by services and assistance, that means the assessments, clinicians, psychologists, and also navigators who help us throughout those systems. Because as we know, it's not just a one-step type of procedure, right, to go and get mental health services, but it takes a lot of steps. So that assistance is a very dire need there and an unmet need for many. Nearly 5 out of 10 all Latinx adults felt they needed mental health services, and they experienced unmet need for mental health care. And that's about half, right, 5 out of 10. And then, and additionally to that, there's 6 out of 10 Latinx adults with serious psychological distress or moderate psychological distress that they have experienced unmet needs for mental health services. And additionally, on top of that, 17% of Latinx adults have said and stated that they did need that mental health services, whether that's for emotional, for alcohol or substance use disorders. So the need is there, the want is there, right? But there's a lot of systemic challenges and barriers. And with that being said, I'd like to introduce our panel who will give us more insights, give us more ideas and solutions possibly where we can synergize and bring all of that together and we can talk about what are the ways that we can address these barriers. Firstly, we have Dr. Aguilar Gaxiola. Thank you for being here. He's the director of UC Davis Center for Reducing Health Disparities. We have Dr. Luis Guzman here as a Latino mental health expert and also has been working with LA County Department of Mental Health. Thank you. George Galvez, I'm sorry, I jumped. Adriana Alejandre, who's a licensed therapist and content creator for Latinx Therapy. Thank you for being here. And George Galvez, Executive Director for Communities United for Restorative Youth Justice. Thank you. So a warm-up question for you all. What does mental health equity mean to you? And let's start off over here, if you can share your name and your pronouns.
Yeah, buenas tardes. My name is Sergio Aguilar Gaxiola, and I'm a professor at UC Davis, and Paola mentioned that I direct the Center for Reducing Health Disparities. And so the question about equity, in this case, mental health equity, is of critical importance because for decades, this is nothing new, but it has been really more pronounced during the pandemic, is those, and I'm going to focus on Latinos, is those Latinos that needing services don't have access to the services that they need. Just to give you a sense, you quoted some findings, but the situation is even worse. I'm a member of the National Advisory Council of SAMHSA, the Substance Abuse and Mental Health Administration Center for Mental Health Services, and they provide us with data, every quarter that we meet. And guess what? Of those who had the most need for services, and those are those who met criteria for any mental disorder, plus substance use disorders, Latinos, 93% back in 2018 did not receive services. Did not. We call it the treatment gap. The following year, 2019, it was 94%. Check the data on in 2020, it was 95%. We had been going on the wrong direction. I had been very much involved in doing population-based studies, and a study that we did in Fresno County with people of Mexican origin in the 90s. And things haven't changed, unfortunately. Those who met criteria for any mental disorders, depression, anxiety, substance abuse, one out of 3 of the US-born, these are people of Mexican origin, US-born, 1 out of 3 were using any kind of services. 1 out of 6 of those who were born in Mexico, and guess what? Less than 1 in 10 of the farm workers, and which is one of the most historically underserved populations. So questions are, why not? Why it is so difficult? And once again, the data, the most recent data at the national level, and also at the state level, there is more recent data, is that the story when it comes down to Latinos, mental health, is the very low utilization of services. One last thing that I want to mention is that when Latinos get into the doors of service, and usually they do it when they are falling apart, there are studies that show that 50, even up to 75% don't return for a second time. Don't return. So the question is, what happened on that first time that they came for services? And guess what? Culture, language, to what extent they felt that they were treated with dignity and respect plays a very important role.
Yes, it does. Thank you, Dr. Aguilar-Gaxiola, for providing that, and also just jarring data on that, how we are basically still in the 90s, right, in terms of mental health equity. So a lot of work there to be done. Dr. Luis, could you share a little bit about your perspective?
Yeah,
there's an on button.
There we go. Let me see. I'll hold it. Yeah, so I think adding to what Dr. Sergio Aguilar-Gaxiola was sharing, is that the data is very, very disheartening, right? And I think if you really start looking at some of the more critical issues within the mental health system, like we're talking about suicidality. During the pandemic, Latina girls, teenage girls, had one of the higher suicidal rates. And you look at services available for suicidal crisis. We have the 988, which is the national crisis hotline. It's the equivalent of the 911 system, but for mental health crises. You look at their ability to serve Latinos, Latinx community, Spanish-speaking Latinx community, and it's very, very minimal. So I think the question of equity is really a question of funding. It's really a question of priority, because when you look at the data, you say, well, there's stigma, Latinos are not returning, maybe the crisis passed, and they feel like, you know what, like the crisis passed, I can move on, I don't need to return. But the reality is the funding's not there. the services are very poor, oftentimes, not because these places want to provide poor services to the Latino community, but a lot of times we're community organizations that receive minimal funding. They don't receive bilingual differential to provide these services. So they're doing the best with what they have, but they don't get enough resources. They don't get enough funding. And so you have a clinician that normally you would think would see 25, 30 clients a week, which is what's typical in private practice. They're seeing a caseload of 40, 50 people, and oftentimes they're bilingual or Spanish-speaking, needing services, and they have a lot of other needs, right, that you don't typically see it in private practice in non-Latino, higher affluent communities. And so really when we talk about equity, when we talk about mental health, you look at the funding, and yes, funding is going to mental health, and we hear all this talk about how mental health is a priority, but I think it goes back to the other a couple panels, right, that we've had on data, right? If we're not really understanding who's receiving the funding, who's being served by this funding, and what are the outcomes, right? Because it's not enough to provide services, but if they're not provided in a culturally responsive way, if they're not provided in a linguistically appropriate manner, people are not going to return because you did not connect with them. They might not trust you, that you have their best interest in mind. And so really, data equity, when we talk about mental health, it comes down to funding and accountability, right? Who's getting the funding? Are the Latino community getting their fair share? And are we holding the systems accountable to make sure that the Latino community gets their fair share? And so we haven't done, like Dr. Aguilar Gaxiola said, we're going backwards instead of forward. And I think that is where Latino clinicians are stepping in, where we have an entrepreneur nature in us. And so I think that's really where we're doing the best we can, but we're also stepping in with our entrepreneur services and entrepreneur spirit to provide the services that the system is not providing to reach that health equity. And I think that might set you up for your next panelist.
Thank you. You're making it easy for me. Yes, thank you for providing that. Already the services and systems are already strained as they are, and even more so for our Latino, for our community, our comunidad. Yeah, Adriana, now could you segue into your perspective about mental health equity and what that means to you?
Yeah, I think as we hear, like there's a lot of frustration because of the statistics. There's a lot of frustration because we're passionate about our people, our communities, and it's devastating. And we were already in a mental health crisis before the pandemic, right? And so after the pandemic, these numbers that you heard are probably worse. And as you heard in the last panel, the numbers take a while to publish as well. So when it comes to mental health equity, it's everything that my colleagues here are saying in regards to accessibility to culturally affirming providers. And I'm going to focus on that because I don't want to repeat what's already been said, and it's also important. In regards to culturally affirming providers, our programs, our marriage and family therapy programs, typically our social work programs, are not giving us that education, us as providers. It's typically extra work, more advanced workshops that we have to do. And so I find that myself and a lot of my colleagues have been as well very frustrated. And so we create our own means, we create our own consultation circles, our own continuing education courses, our own Facebook groups where we can talk amongst one another and create this mental health equity among the providers to be able to provide culturally affirming services to our community. And then when we think about mental health equity, it isn't just psychotherapy services as well. It's also accessibility to holistic care. Yes. Because people in our community are very diverse and they heal in different ways. And I know that therapy is great. I'm a mental health professional as well, but there are moments in our lives where we also need something else. Ancestral healing is just as okay. And unfortunately, when it comes to mental health equity, the statistics don't reflect that because I think our medical model is so focused on westernized ways of healing, and it doesn't acknowledge this ancestral indigeneity type of healing. Thank you. That's all. You guys make me shy.
Thank you for speaking so powerfully on that. We were hearing you. Can you speak on that too as well, please?
That's a good segue. So first, let me begin. Greet you all the way. I was taught by my elders. Ha metaki ape, yahani washte. Say hello, my relatives. It's a good day. And yeah, just kind of on that vein, you know, my elders also taught me you don't really know where you're going unless you know where you've been. So I want to invite you all to kind of go back with me in time. You know what I mean? Let's take it back to the old school because I'm an old fool who's too damn cool. You know what I'm saying? Let's take it back to 1492, y'all. 1492, there was a clash between two irreconcilable worldviews. That of the settler colonizer, that's reflected in what we call the 3 Gs. Greed, gold, and genocide, which manifests itself into the capitalist mantra of today of maximize profits, minimize expenditures, where we value money before we value people. So we're gonna have to talk about the commodification of mental health and medicine, right? Versus the indigenous worldview that's reflected in the Mayan expression of En Lakesh, tú eres mi otro yo. I'm a reflection of you, you are a reflection of me. We belong to each other. The Lakota say, mitake yasen, all my relations, we are all related. So when we think about the historical and intergenerational trauma since 1492, which is now compounded by current systems of oppression, it's also important that we reroot ourselves in the fact that we have historical and intergenerational wisdom. We have historical and intergenerational culture, la cultura cura. Culture is healing. So what does health equity look like to me? It's about validating the ancestral traditions, you know, as our sister was just saying on this panel. It's about creating accessibility so that Medi-Cal or Cal-AIM and all those things, like they should fund those things because let's be real, the settler colonizer paradigm of mental health is broken by design. It is not meant for us. And when we talk about the Spanish-speaking world, because like what is a Latinx anyways? What is that? It's an ethnic identity. What do we have in common? We were colonized by Latin-speaking countries, Portuguese, Spanish, right? And so there's a common thread in terms of language, but who are we racially? Most of the Spanish-speaking world are people of indigenous and African descent. So we don't talk about that. We don't talk about the need to affirm ourselves in our ancestral culture. We do this too much blending, which that's a result of colonialism, was to deny us our identity, deny us our traditions, the violent hegemonization, synthesization, and assimilation is part of that historical and intergenerational trauma that we're experiencing. So I'll just say that much for now.
Thank you, George. Powerful. Thank you to all of our panelists for starting off with that warm-up question. And I'm just seeing this thread, right, since the beginning of this summit, right, but really it was explicit out there by what Luis mentioned, right, these systemic issues and how they affect and traumatize, right? Systemic trauma, right? And currently, right, there's so many systemic challenges. And Dr. Aguilar-Gaxiola, we would like to hear, you know, what are the current systemic challenges that our comunidad are experiencing, and how do we address those inequities, those systemic traumas?
Yeah, I would like to focus more on the underutilization of Latinos of mental health services, and it is related to the question that you're asking. Actually, is at the heart. We have studied what are some of the barriers that Latinos experience that preclude them from accessing services, and you know. Personally, along with many other colleagues, we have studied perceptual, institutional, and structural barriers. And I would like to share with you the top barriers that they told us that they are experiencing. And these are folks that are really in need of mental health services because, you know, they met criteria for severe mental illness. And the top 5 barriers to mental health service included, and these are phrases, I should be able to handle it on my own. This is part of stigma, by the way, having this idea that they don't need services when in fact they are falling apart. The wives say it, the children say it, but it's very difficult to accept that. Another one is, I don't know where to go. Just think about it, needing services and not having even the most basic idea about where to receive the services. Another is, I wouldn't have a way to pay. Affordability is a really big issue because a good proportion of Latinos are not insured. I'm thinking about a population that we have been working for years, and those are farm workers, for example. 50% of them are undocumented, and even though they work for 7 days a week, many of them, they don't have a way to pay for the services. Another one is, I think it will go away on its own. Stigma, okay? And I don't have a bad enough problem to seek help. Stigma. And a stigma, we need to consider that is the most important factor that prevents Latinos and other people to get into services. They are having the experiencing the problems, but they are not accessing the services. And by the way, very quickly, had been working on the health equity, mental health equity for decades. And I have thought about this through the years. And we keep thinking that if we build it, like the field of dreams, Latinos are going to come. That is not going to happen. There are so many factors associated with that. That I come from UC Davis. My office is 2 blocks from the medical center, and we have primary care clinics. And we operate like other systems operate in what I call the waiting mode. It is, here we are, come to us, waiting for people to come, when we know for decades that they are not going to come. So we need, you use the word paradigm, we need a paradigmatic shift from being on the waiting mode to being in what I call also the seeking mode. We go to where they are at. We know what are the barriers to care, as I mentioned to you. There are some of them. And what we need, and we know how to do that, actually. The pandemic taught us that it is possible to provide services through digital health means or telehealth services. And they are here to stay. Actually, as I'm talking, we have a project that is operating on the seeking mode, that we go where people live, where people work, and where people congregate. And we do preventive health screenings, including depression, look at for severe depression. And then on the spot, we provide services depending upon, how they are doing. So a paradigmatic shift is very much needed because guess what? Shift happens.
And hopefully we'll get to see that shift happening, right? Yes, definitely resonated with, if they build it, will they come, right? But we have to go out there, we have to engage, there's just so many already barriers in itself. Transportation, for example, is one of them, right? But then in language, cultural sensitive type of programming. Dr. Luis, the line of work, right, in general, right, with engaging promotoras, promotores, to really be that key, right, within community, between community and these services, are one of the ways to address those gaps, those systemic barriers. Could you speak just from your expertise, right, and seeing promotoras in action in your community, how that has addressed those systemic barriers or systemic gaps that in mental health services.
Absolutely. I think I want to take a step back to lead up to that question. So, you know, we have a really big, robust promotora, mental health promoter program in LA County, both in LA County Department of Mental Health and Public Health. But I think the system, you know, and this is one of the ways that the system continues to not do right by our community, right? And so what we saw during COVID is that promotoras were the ones, you know, people like myself were allowed to telework. People like the promotoras, they were out in the community every single day because their job does not allow them to telework. And so they were in the community. They really were the ones that kept the community from really falling apart when it came to their mental health, because they were out there day in and day out talking about mental health and reducing that stigma and having those conversations with the community, in community, right? And so what systems then turn around and do is they say, well, we have a shortage of Latino providers. We have a shortage of bilingual providers. So what are we going to do? We're going to use the promoters as a substitute to start taking on more and more of that work and that load that really belongs to the clinicians. But let's use the promoters because they're in the community, they have the trust. Let's use them to fill those gaps without compensating them, without giving them the resources, because we know they're dedicated, they care deeply about the community, and they're gonna do the job and we don't really have to pay them for the job that they're doing, right? And so when we talk about the community mental health promoters, they are, all the promotoras, promotores, they're amazing. They do amazing work in the toughest of environments. And then the system turns around and then, you know, does these kind of things. And so what part of the work that I've been doing is then going back to the system and really advocating for them, but really building up the community, for the community to know how to speak up, to be at the table, to have a voice, and to demand that the department, the county, the state does right by us. Because the promoters, they are very loyal. They will do their job day in and day out, and they will not say anything because they truly care about the community. And so it falls on people like myself, the community, and others to really stand up and say, hey, you need to do right by the promoters, you need to do right by our community, because we have a lot of needs and it's not fair to put them on one group. And so what I really work to do is to educate, empower the community, give them that voice, help them find their voice, to get to a place of self-determination. Because the community is the one that really knows what they need, what healing looks like for them. It's not for us to decide. And so by giving them that, helping them find their voice, and helping them find the strength that they've always had, then they can go to the department, to the state, to the cities, and say, this is what we need to heal us. This is what we need right now in terms of resources and services. And so I think, yes, the promoters are great and they do amazing work, but I think this is an example of how the system continues to find ways to not do right by our communities. And so the work is very, very challenging, at least for me, because I'm in that middle role of, I'm a liaison between the government, the county, the state, and the community. And so really my job has to be been to really help the community engage in that advocacy and self-determination work, because it's not for me to decide what's best for the community. It's really for them to have the tools to then engage in the work so they can get what they truly need. So it's been a challenge. I started doing this job right before the pandemic hit, a month before. So it's been a little bit of a challenge, but I think now the community, and I think going to the other panel of data disaggregation, really for me, it's been going out into the community, doing that work, that grassroots level work, not just with the Latino community, but the Mesoamerican indigenous community, so Cielo, Mundo Maya Foundation, and really helping them understand this complex system so they can then engage in that advocacy and self-determination. So I don't know if that, I rambled a little bit at the end and I answered your question, but it really is a collective effort.
It really is. Yeah. Thank you for sharing, and no truer words, right? With promotoras and promotoras, as we've seen these practices, right, with basically their heart is there, right? The heart is there, as Lourdes mentioned earlier, but the compensation and that workforce and making that a possibility for all promotores and promotoras is still a lucha that we will continue. And so thank you for elevating that, Dr. Luis. A follow-up question in regards to that, and just in general, right? The systemic issues that prevent our community from accepting care could, I'm sorry, I jumped myself here. Actually, yeah, the systemic issues, how do we move from individual responsibility to a systemic responsibility? And that's for you, Dr. Luis.
Oh,
yeah.
Right. So really, the counties put this data out there in terms of who's being served. And so some data's out there, but really it's as, and I say easy, but it's as easy as us being informed on what the county, wherever you live in the state, what the county's doing, who they're serving, and then demanding accountability. Because it's really, and Dr. Gaxiola mentioned earlier that, if you build it, the typical notion is that they'll come, and that's what the systems are set up, right? So really demanding accountability, because it's the responsibility of the systems to go out and to meet the community and to address these issues. And if there's stigma, to me, stigma does not mean that I'm embarrassed of getting services, is the system is not doing enough to make me comfortable and trust them in getting these services, right? They're not meeting me where I'm at. And so really it's about understanding what the county is doing, understanding what the main issues are in your community, and then collectively working with others to go out and demand this accountability from the system, because again, it's very typical to see it, well, the Latino community, they're resistant to services, or the machismo, or, they're resilient, they don't need services, and so they don't seek them, when that's not really the truth. An example in LA County, in 2020, about 400,000 Latinos needed services, or reported needing services. Out of those, we had about 15,000 that were served through the Medi-Cal system. That's about 390,000 Latinos that did not get the services that they needed through the Medi-Cal system. These are Latinos that are saying we need services, right? And so it's really about accountability, and it's really about just finding out what is the county doing, making a public comment, going out and talking to your elected officials or whatever it is, talking amongst yourself, even among your familia. I think for a lot of us, we in these spaces, we're very comfortable, but when we get home, when we have our family barbecues, nobody wants to talk about depression. La tía tiene depresión, let's not talk about that, because we all know that grandma or abuelita has depression, but let's not talk about it, right? And so I think it's just having those conversations, or difficult conversations in all spaces, and holding the systems accountable for what they are doing and not doing.
Thank you for sharing. And yeah, LCHC has worked on the MSOAC project, which is basically the oversight and accountability committee for the MHSA, which is the Mental Health Service Act. And even navigating that to be part of stakeholder meetings, which all of us can be part of in our own respective counties, was very difficult. So I can't imagine how it is for folks who speak other languages in English, or having difficulty navigating online to look for those contacts. So there is definitely still a lot of work there to be done to connect our communities to those portals and places that hold that accountability to those committees. So thank you, Dr. Lees, for sharing that. Adriana, we have heard about all of these systemic challenges accessing mental health, but you and the content that you're creating is really using all this, harnessing all this power of social media to really address mental health and destigmatize it too. So we were just talking about the stigma that it brings about. And could you tell us about your experience being an influencer as a Latinx mental health in the space of social media?
Yeah. Oh, am I on? Yeah. Thank you. I don't know if I'm an influencer or content creator, but whatever it is, y'all get the point. Raise your hand if you know the song Según Quién by Maluma and Karim León. Okay, thank you. All right, so
that's your jam, I take it.
DJ request.
You know, it's trending right now on TikTok, and what I do, the reason why I ask is because I use lyrics from songs that are trending and integrate facts. Yes. I can't remember the lyric right now, but it's one of my most recent reels right now and videos on TikTok where he says something like, something that like, if someone's going to get it wrong, then make sure you get it right. If someone knows the lyric, please help me out. But anyway, that's what I do. I take like just a little version of it and I make it culturally relevant and I provide this content in English and in Spanish. So I translate it, or I do my best to, because it is very difficult sometimes. I was born in a monolingual Spanish family, and then my parents said, you know, they wanted us to assimilate. So when they put us in elementary school, they had a Spanish program and an English program, but they said, you know, no, put my children in English-only classes. And so we lost our Spanish at home because my parents faced so much discrimination. And, you know, we hear stories like that time after time. Now, when it comes to my role as a social media content creator, it's something that I fell into because of the community. When I first launched Latinx Therapy in 2018 as a bilingual podcast, I didn't know that it was going to become a directory, a national directory. When I launched, it actually went viral in 2018 because Apple Podcasts gave me a feature right next to Oprah, and Oprah was like huge in 2018. So they gave me one of their biggest features on their homepage, and I started getting emails from folks across the nation telling me, I never thought to go to a Latina therapist. I always just went with whoever my insurance gave me. I always just went with whoever was available or nearby. I just never thought to go to somebody that was, you know, culturally related to me. And so one of the first podcast episodes was When La Chancla Crosses the Line, right? Okay, so we're using content that is very culturally relevant and educating our community about it with a mental health focus through the podcast, through our social media channels, and through speaking engagements like this. And so, you know, going back a little bit to when we launched and went viral, people started telling me, where can I find a therapist in New York? Where can I find a therapist in Texas, in Minnesota? And there I was Googling, you know, like, where are they? Where are they? And so I created a Facebook group of Latinx therapists back then. And then from there, I was like, I'm burning out. I'm getting so exhausted. Like, you know, just me by myself finding these therapists for people across the nation. And so that's where it took me about 9 months to build the Latinx Therapy Directory. And so here we are today. I believe we have about 600 Latinx therapists. And yeah, thank you. So, you know, that's been a little bit of my role, but it's come from frustration. Thank you. Yeah, the first year I got licensed, I got licensed in 2017, and I felt so frustrated. And I was like, where is my community? I know I shouldn't have a wait list for services from people that are looking for therapy for the first time. I said, my wait list is probably like, I don't know, 6 months out. I was still figuring things out. And I was like, it isn't fair to them. So all of that frustration, I channeled it, I guess, into advocacy. I didn't realize it and created something like Latinx Therapy today. And now the foundation, Alejandra Foundation, which is a nonprofit that gives 8 sessions paid at $100 per session to the provider for our community specifically.
Beautiful, beautiful. Thank you so much for sharing the work. It's evident all of our panelists are passionate about this. So thank you so much for sharing your passion as well. And just a follow-up question to you, Adriana. I think you did mention a little bit why it's so important. I mean, I heard New York and other places that it was really hard to find Latinx therapists. But could you tell us why is it so important for Latinx to receive your message to begin taking care of their mental health? I know it's a big question.
Yeah, I'm gonna answer it very briefly, but mental health is everything and it's everywhere. It's within us every single minute, whether we give it attention or not. It includes our physical health, it includes our social health, which we noticed it suffer after the pandemic due to being in quarantine or being in isolation, right? It includes our spiritual health as well. It includes our psychological health, which can also include our emotional health. It's everything and everywhere. Mental health, it can't be ignored. And again, mental health doesn't mean therapy necessarily. Mental health is your wellness, your well-being, the way that you're taking care of yourself with all those pillars that I just mentioned. And so when we start doing that, when we start giving that more focus, you'll be able to see a difference in the way that you view yourself and the way that you view others and also the world. You'll be able to go about life, I think, with a little bit more energy when I think back to my healing journeys and also my role as a therapist, and from what I've witnessed, people report, share with me that they just feel more energized, they just feel a little bit more livelier. There's just a shift.
Thank you so much for sharing. And I heard that it's not just mental health, right? It's emotional, it's spiritual. Whether you call it holistic, whether you call it social determinants of health, right? There is something there, right? That there's so many other parts of our lives that really impact our well-being, our mental well-being, our mental health. So thank you for sharing that. And along those lines, George, your organization has really shifted that with youth, within the youth justice landscape by using a framework like that, right, which is a holistic framework, social determinants of health framework, if you may, and making the case that young people do need that mental health services, access, lifeline resources. That includes education, jobs, and whatnot, healthcare as well. And this is an alternative, if I may, right, an alternative to what is usually the traditional systems, right, which is the youth justice system. So rather than funneling our youth into such a system, right, why not support within this holistic way? And then in your work, some of the most pressing mental health needs for young Latino people, could you tell us what those are, and how can we as a community fight for mental health rights of young people?
Cool, great question. I think kind of jumped right into it, so I think I want to just take a moment, pause to maybe just do a little conocimiento, share a little bit about kind of what informs my values and the practices that we use. And I'll just begin by saying, I have the distinct privilege of working with young people with very similar lived experiences as myself. And so when I think about one of my very earliest childhood memories, I was 3 years old, and I witnessed my father trying to kill my mother. And I have this visual image that's very, very vivid of my father just putting his fist through the wall like it was paper. My mom's feet dangling from above the ground, and my mother turning blue, and me running across to get help from our neighbor. And that's about as much as I remember from that. And I say that much to say that the violence that was produced in my home, I ended up reproducing on the streets later on as a young person. And I also internalized a lot of negative male socialization that, where there's a lot of false teachings, right? They get reinforced, machismo and things like that. And so I internalized that idea that, that there was weakness in crying. And so I numbed my pain through violence. In my adolescent years, my pain that was kind of suppressed became anger, my anger became rage, my rage became violence. until at the age of 17, I was incarcerated. I was charged with multiple felonies for my involvement in a drive-by shooting. I was also labeled, gang labeled in multiple gang databases in several Bay Area counties. And so I say that much to say that the young people that I work with are oftentimes pathologized. I know I certainly was. And when we do that, we sometimes create what's called a self-fulfilling prophecy, right? In psychology, it's the Rosenthal effect, right? And we sometimes unknowingly and unintentionally reproduce systems of oppression through these paradigms, settler, colonizer paradigms. The Western approach to mental health is problematic. It doesn't suit our community because it requires detachment. Like, that's one of the first things they require is detachment. When the first fundamental need that every child has is connection. And how do you build connection? So if I'm a Western clinically licensed therapist, I'm not supposed to share my story. What I just shared with all of you, I would, I would be, ostracized, basically, within my profession for taking time to share my personal lived experience. But with our young people, when I share my story, there's a relatability and there's a connection that's made. And they don't have to have my story. We all have a powerful story. So courage really operates on the fundamental belief that every young person is a blessing and that every young person has a sacred purpose. All of the empirical research and evidence also shows that the more contact our young people and their families have with systems, the worse outcomes are for them. So I work with a lot of young people caught up in the criminal legal system, but it's not just the criminal legal system. It could be behavioral health. It could be social services, whomever, you name it. Whatever system, more contact, worse outcomes. So what does that mean? I am an unapologetic abolitionist. And I'm not just trying to abolish the prison system, but a lot of these other systems criminalize our communities and reproduce these systems of oppression as well, right? So I'm really a proponent of how do we shift away from those systems that have really created more trauma, perpetuated the trauma of our young people, profited off the trauma of our young people and their families, and shift into community-led solutions and investment in that infrastructure so that we can create spaces and places where our people can heal, grow, and thrive.
Thank you for that. Thank you. I know that it's a huge, huge question, right? How can we help? How can we help? But there's just so many ways, but also it's systemic. It's something that we collectively have to abordar, right? And get together and work towards that, especially for our young people. I wanted to just quickly ask Adriana, I think maybe some folks might have this question on their mind, but could you share with us your handle really quick in case if folks don't know?
It's Latinx Therapy on everywhere.
On everywhere. You heard that. All right, round of applause for our panelists. Thank you, thank you. And before we move into general questions, we would like to show some slides. I know we have a few resources, correct, that we want to share out? No? Okay, just kidding. Maybe I can pass it over to you all. Let's share some resources because many times, right, these spaces where we're talking about such things, right, brings to mind that we really, either that's individually, for somebody else, really, it could be a life-saving service. So I'd like to just do kind of a roundtable here with sharing some resources, whether that's general resources, if you have any, or local county resources that come on top of your mind in lieu of the site. So we'll start with you, Dr. Sergio.
Well, thank you for that opportunity. There is a website that we started with other colleagues from UCLA and a private, and a digital vendor that is called Together for Wellness, Together for Wellness. And if you Google it, you are going to find it. And we have it in 13 languages, including, of course, in Spanish. The Spanish site is Juntos por Nuestro Bienestar. And if you just remember Juntos, CA for California, juntosca.org, you are going to find it. And also, we just, starting with Mixteco as well. 2 variations of Mixteco, Mixteco Alto, Bajo, y Mixteco de la Costa. And we are in the process of including content for Mixteco as well. We have, since March of 2020, working on this website that is, with very curated information, videos, applications, fact sheets, and also we take into consideration the age of those who may look at these resources. So I would, because those who need services, the greatest majority just basically need information and need just orientation as to what to do if they are facing depression or substance abuse. This kind of an engaging website could be really a good resource for the majority of the people. Of course, depending upon the level of need, then they will require sometimes even hospitalizations. And by the way, I think that is so important to mention that, I had been in the mental health field for years, and is that what we are seeing in terms of suicidal ideation and suicidal behaviors in youth, and Latinos are surpassing other groups at the national level and here in California. That is so important to become aware of that and to open up spaces so the youth, especially adolescent Latinas that you mentioned, Luis, that they are able to having conversations with their parents, with their peers, with their teachers, about these issues. Because we have, Latinos, we have a culture of silence, It's very uncomfortable to talk about these things, but it's so necessary. Because I have been hearing, even with farm workers, that as a child, 14 years of age, killed himself, or another girl who hung up herself. Haven't heard those things before. And so just keep it in mind. And I think that collectively we can do something about it.
Thank you very much for sharing. Very, very heartbreaking to hear, for sure, but very important to know. Dr. Luis, could you share some few resources, if you have any?
Well, actually, yeah. So I mentioned earlier the 988, and that's nationwide, right? That's the suicidal and just mental health crisis lifeline. And so that's all. And they also have a text line for teens. And so the more you use it, the more you call the federal government. This is funded by the federal government. So the more they have data to continue to fund it. And so 988 is anywhere in the country you can call. And what they do is they dispatch a team. If it's it's a crisis, they'll dispatch a mental health team, basically in the same way that they would do if you call 911, where they would dispatch either ambulance or police. But instead of law enforcement, you're getting a mental health crisis team. So again, anywhere in the 50 states you call, 988 is always a good one. The other one, and this is a more local one, but we do have a lot of videos and resources and directories, is LA County's Department of Mental Health. We have the underserved cultural communities, and that is our effort to specifically target our underserved cultural communities And you just Google it, LA County USCC or underserved cultural communities, and you'll find for the Latino community, you'll find for Black African Heritage Community, API, LGBTQ, AI2S, all kinds of resources, videos, infographics, and so those are free for anybody to access and use. So that's always a good resource for anybody.
Thank you so much. I'll pass it over to you.
Yes, so there's the Trevor Project, there's openpathcollective.org, which is a nonprofit directory, and there's also, I'm going to say my website, latinxtherapy.com. There's a lot of resources, what questions to ask a therapist, bilingual books in English and in Spanish for adults and for children, YouTube and YouTube channels, different apps, etc. There's also from my foundation, we have across the nation different therapy funds, alejandrefoundation.org/resources. And I'm self-funded, so if you all have any resources or grants, that we could apply to, please also share. Pass it on.
Cool. So that courage, us and our allies, we don't just sing it, we bring it. You know what I mean? So we have been actively involved in building the alternative to incarceration, creating that place where young people and our families can heal, grow, and thrive. We were born out of the gang injunction organizing 13 years ago in Oakland. My co-founders were defendants in the Fruitvale gang injunction. And we were very cognizant at that time, not just what we were saying no to. We said no to gang injunction zones that criminalize particularly Black and brown young people. But we said yes to this concept of youth power zones that take a strength-based approach, an asset mapping approach and framework to our young people. And so, fast forward, this spring, I invite you all to come to the grand opening, April 28th. We're gonna have a block party for what we are calling the Oscar Grant Youth Power Zone at Fruitvale Station. Oscar Grant, for some, I'm assuming most of y'all know. If you don't know, you better ask somebody. But Oscar Grant was 22-year-old young Black man who was murdered by Officer Meserly, a BART police officer, 14 years ago on the Fruitvale BART platform. And they immediately tried to weaponize the fact that he was previously incarcerated to, just basically rationalize the irrational and defend the indefensible. So we say, never forget and never again. And he represents the young people we work with. So to honor his legacy, we organized to get the unnamed street in front of the Fruitvale BART station, named Oscar Grant III Way, for the 10-year anniversary of his murder and execution. We organized to get the BART administration to pay a community artist of our selection a memorial image of Oscar. And now we're gonna continue to brand that Fruitvale area with Oscar's memory. So that's a resource. That's a resource. We are creating a demonstration model for what decarceration looks like. The other thing I'll say is our allies, Young Winds Freedom Center, some of you might be familiar with, is creating the Beloved Communities, and they are creating opportunities for femme, girls, women, transgender, folks who are coming back home from incarceration to have access to housing. Because let's be real, the rent is too damn high. You know what I'm saying? And we know that a lot of those kinds of economic pressures can perpetuate depression and anxiety and a lot of other things, right? So people need their basic needs to be met: food, clothing, shelter. And then lastly, one of our close allies is the Anti-Police Terror Project in Oakland, California. And so we organized collectively to create something called Macro, which is housed in our fire department as an alternative to 911 and policing to provide mental health services for folks who are in distress. And they've also just created the People's House in West Oakland. So yeah, those are some resources. The last thing I'm gonna say is on the previous panel, I know you want me to wrap it up, but just one last thing, y'all. The previous panel, there was an excellent question that resonated with me about working with indigenous communities and research. And the truth, so another resource, I'll just share, I gotta give a shout out to my wife because she's a badass. She's amazing. So she's like one of the folks who's all about decolonizing research and this whole extractive relationship of research, right? And it really informs a lot of my work because when you do community-based research and social action research, there's something cathartic when people find their voice and power through that process, when they have agency through that process, you know what I'm saying? And she does a lot of narrative work, storytelling work with farm workers, with campesinos, with indigenous communities. So I'm gonna just say my wife is a resource.
Thank you so much. So folks, we ran out of time, but that was such a good convo. And it gives you the opportunity to come up to them, have a one-on-one convo, and ask your questions at that level. We really, really appreciate you all. Thank you so much. Thank you for sharing your perspectives, being vulnerable, being open. Shout out to you all. And thank you, community. Appreciate it. And we'll pass it on over to our MC. Thank you again.
What a wonderful conversation. Oh, last picture, of course. Yeah. Paola. Se requiere su presencia. And yes, feel free to take pictures. This is a whole experience. We want to make sure that all of you are learning, having fun. Feel free to tag LCHC. If you want to go ahead and tag Telemundo as well, we also love to see your pictures, having a fun time in this summit. I'm also taking pictures over here, so if you see me posing. Muy bien. Muchas gracias. Another round of applause for panel number 3. Thank you so much. What an important conversation about mental health. So far, we've had so many interesting panels. First one was about fighting for greater workforce diversity. The second, we heard about experts ensuring that data represents our communities. And now we were tackling on this important issue about mental health in our Latin communities. Now, this brings us to our last final panel, panel number 4, which really brings all these topics together. And it's really about on the importance of how we share, how we talk about our stories. So this is a very fun group. It really is a very inspiring group as well about how they tell our stories in different fields, in the local newsrooms, in courtrooms, through TikTok Reels, and even on the big screen. So I'm very happy to introduce this final panel called Our Gente in the Media, Latinx Transforming the Greater Narrative. Moderator will be LCHC's Senior Communications Manager, Robert Nunez. So please, round of applause.
Muchas gracias. Hello, buenas tardes. How's everyone doing? ¿Cómo estamos? Good? That was a little low energy. Why don't we do a little activity while folks in the back come back to the front while we get our familia together? All right, when I say health, you say equity. Health. Equity. Health. Equity. All right. When I say Latinx, you say health. Latinx. Health. Latinx. Health. Beautiful, beautiful, beautiful. Okay, so my name is Robert Nunez, or Roberto Nunez Aguayo in Spanish, and I'm the Senior Communications Manager for LCHC. I'm really excited to be here today. This is a really important conversation. It's really timely, and it's called Our Gente in the Media, Latinos, Latinas, Latinas Transforming Health through Changing the Greater Narrative. So with that, I'll have all of our speakers come up. Or maybe I'll present you one by one, and then we can have you all shuffle up. So first we have Bambi Salcedo. She is the president and CEO of the Trans Latina Coalition. All right, and next we have Gerardo Cabral, who works with ABC 10. Thank you, thank you. We're gonna bring up Juan Espinosa. He's a lawyer, an advocate, and he's worked in entertainment management. And then last but not least, we're gonna bring up Belisa Escobedo. She's an actor and an activist. You may have seen her in recent films like Hocus Pocus 2 and The Blue Beetle, DC's Blue Beetle. Welcome, welcome, welcome.
Thank you.
All right, so thank you all for joining. First of all, it's really exciting to have you all on this panel. A little bit of background. So when the team, we are kind of going through what this fourth panel should be about, and we are really discussing how much Latinos are part of the fabric of California, whether that's in politics, whether it's in education, whether it's in the media. You know, Latinos really make up such a big part of that, and that's demonstrated by the wonderful superstars panelists that we have here, all in their own roles and their own issues. So yeah, we can explore a little bit of what it means. And I'll start off with a question for all of you. So, and we'll start with Bambi, and then we'll move this way. So can you share with us why telling Latinx stories is important to you?
Hola, hola. Hi. Thank you. Bueno, primero que nada, a mí me gusta darle gracias a Dios por darme la oportunidad de tener un día más de vida. Quiero honrar también la tierra en la cual estamos hoy en día y obviamente quiero honrar su presencia en esta tan importante discusión. For those of you who are not able to understand, I always honor my Creator, my higher power, for giving me the opportunity to be here with you and for the opportunity to breathe one more day. And I honor the land where we're standing on today, and I also honor your beautiful and amazing presence. So why it's important to tell our stories in the media? Well, one, and primarily because people are not able to tell the stories that we are able to tell, like our own stories, right? And that is why I made the decision to also enter into this other field of executive producing content that speaks specifically about the needs of our community. So I want to invite you to check TLMshorts.com, and that is I executive produced 25 short stories of trans people who have crossed borders. But we wanted to make sure that we don't tell the story in a way that is like in a victimizing way, right? But that we're also able to tell the story of how is it that our community, despite of the multiple challenges that we experience, that we are able to also overcome, and that we're also able to just function in the world the way we are able to thrive. And so it is important that we are able to tell our stories because we should, because we do have the ability. But I think it's also important to recognize that there is a lack of resources and investing in, you know, telling our own stories. We don't need Hollywood to tell our stories, right? We are able to create our own stories.
That's beautiful. That's like something we say at LCHC. We say power, not fear, whenever we're telling our stories. You know, even LGBTQI stories, there's a lot to, you know, even in this time, there's a lot to be fearful of, but at the same time, we celebrate those stories. So thank you. Gerardo, we'll pass it on to you.
Yes. Everybody hear me okay? Yes, well, hello everybody. Beautiful room. So excited to be here. Well, I have a unique role. So I serve as a community relations manager for ABC 10. So I'm not a journalist at all, but I do work closely with our journalists and our amazing team of passionate folks. And what I would say is, why is it important to tell our stories is why not? I'm the one always challenging in the newsroom. Anybody who wants to hear me, who doesn't not want to hear me, I'm still going to say something. It's just we're beautiful. We have a story to tell, and you know, recently the Sacramento Hispanic Chamber of Commerce just came out with a report saying that, you know, the population is 33% Latinx, and we are a thriving region filled with culture, passion, stories, and in the newsroom, it's not really reflective of that. And so for me, I've been at ABC 10 for about 2.5 years, and I have worked very closely with a lot of our race and culture team, which we have a very unique space there, we have journalists who are fighting in the newsroom every day to make sure that every story is being told, and that we could really not only tell it with about them, but with them. And so I think it's extremely important for us to tell that story, because why not? Because again, like, we have a beautiful place or beautiful thing to share. So yeah, it's a little. I mean, I can go into more details about that. But
Yeah, definitely like that. With not about us, with us. I like that a lot. We'll hand it down to you, Juan.
Hi everyone. Thank you so much to LCHC for having us. I'm really grateful to be on this panel and to be here today.
Thank you. You need to turn off.
You just got to speak into it like a detective. It's a secret.
Whoop! There. Yay. Okay. Thank you. I'm really grateful to be here today, and I guess I also want to start by acknowledging the conflict and speaking of stories and the importance of stories and stories being wielded to inflict violence on peoples and communities. And so if anyone is feeling that pain today, I want to extend that solidarity and address the importance of building empathy using stories. And that's a lot of the work that I do. I have a filmmaking, storytelling background and decided to pursue law school to use stories as a way of fighting and to be able to wield stories, because in my navigating of either using culture or story for change or using the law for change, I've found that using stories is way more powerful, long-lasting, and convincing. And so for me, storytelling is about building empathy. It's about also a love letter to my abuelita, and like those overnights where she would tell me stories till I fell asleep, and she remembered what she was wearing and what the food smelled like, and those incredible stories that we've all grown up with, that are a part of who we are, that we are storytellers, and that we be treated as such. And so for me, that's the importance of telling stories.
Thank you.
It's on.
Yeah, I think we can hear you.
Yeah, it's on. Well, hi, thank you so much for having me here. There's an amazing panel. All the answers that have been said, phenomenal. Really resonated with what you said about it being able, our storytelling builds empathy, not only with us, but with other communities. For me, why is Latino storytelling so important? Because it's all I know. It's what's closest to me. It's what I know best. It's, you know, my abuelita and her stories, my tias, and hearing their stories about the grocery store clerk and how their, you know, nephew who's still in Mexico was dating, like just the craziest long-winded stories. And that's what I want to see. That's what I find the most entertaining when I see it. And it also, I believe that media, especially right now, is one of the fastest and like most accessible way to get information out there. And so, you know, seeing something, I don't know, from an entirely different community who you have had no interaction with, have never known anyone from that community, but seeing their story in a movie, suddenly you're like, I had no idea any of this was happening, but I feel empathy, I can relate, but who knew I could relate to this community? I mean, storytelling is truly so powerful, and just as much as any other community, we have just as much right to be out there putting our stories out, and it's very important. Yeah.
Absolutely. And you're doing an amazing job. Awesome. So with that, I'm going to dive a little bit deeper into what y'all said. Gerardo, so we'll start with you. We want to ask, what is your approach to storytelling, and how do you see Latino stories impacting the mainstream media? And so what is the importance of highlighting Latinx stories and the people in the news? And what do you think is the impact that it can have on politics, healthcare, just highlighting those stories locally and at a state level?
Fantastic. That was like 6 questions. So can we start with the first one?
Yes, please.
I was like, wait, okay, I was ready to answer the first 2, then you kept on going. But say that one more time. What's
sure.
The first,
so the first part, what is your approach to storytelling, and how do you see Latino stories impacting mainstream media?
Yeah, my approach is, 100% authenticity and just listening to, honestly, I see snaps, but like, yes, that's all I know as well. I think I pride myself in being a community connector, and in this role, it's all about listening. And so when people say, hey, you're from ABC 10, they're like, oh, I see you on the news, and I'm like, no, you don't, because I'm not on the camera. Like, so I'm like, okay, you don't watch the news, but I'm here to listen, right? And so, because everyone has a story to tell. Everyone in here, I like invite you all to like have coffee with me. I'm just a storyteller, and I love to listen to the beautiful journey that we've all gone through in life. And so, as someone who's on the boots on the ground with my news station, I'm out in the community alongside with my community engagement team, and we're listening and we're hearing things, whether it be good, bad, or the ugly, and what we want to know. And so that impact is so important. And so for me, my approach is active listening. It's a lot of work. It's a lot of and hear, as I'm pretty sure a lot of our journalists, reporters hear and do the same. And so I do my due diligence in really trying to listen, ask them like, what would you like to see? And then pass it on to our journalists in newsrooms, and then connect them in the spaces where we're able to really elevate their voice or even enhance the stories. Because again, we've done a culture shift, at least at our station, about like, we're not doing stories about a community, we're doing them with them. Because again, we only have a certain amount of reporters in our station, and they can't be everywhere. And we cover Sacramento, Modesto, and Stockton. And so it's so important for our community leaders like yourself to really reach out, not only reach out to us because we try to do our best, but I invite everyone, to email me or to email our station to really pitch your stories. Because again, we don't know what's happening if we don't hear from folks. And so I think that's my approach to why it's important. I think, representation really matters. And I think at ABC 10, we've done a better job. I'm not going to say, we're getting better at really telling the stories of our community, but also having people in front of the camera who actually look like our community. I think that's still something that we can definitely work on. But again, like I had mentioned earlier, is we do have a race and culture team who's been extremely dedicated to ensuring and a quite advocate and a fighting advocate in the newsroom to ensure that those voices are being heard and these stories are being told. And then we work alongside with our community partners to really help, like, to make sure that we're telling it in the right way.
Right. Thank you.
That was the first 2?
Yeah, I'll jump into that second part now. So that sounds a lot like what we try to do at LCHC. We try to be that connector as well. So all the policy we try to pursue, we're really bringing community on and having them tell their stories. You can see that in SB 435, how Indigenous communities, Indigenous community members really drive the work that we do. So we definitely see that that intent. So with that, how do you think highlighting these stories, Latinx stories in particular, what impact do you think that can have on California politics or healthcare?
I think the impact that it has is, I mean, we are another source of providing information out to the people who still watch us. I have to say who still watch us because, again, we are the news, and a lot of the folks, when we're out in the community, we ask them, how do you get your news? They don't say cable or TV. So it's one of the outlets of many, right? And so we do we're doing our due diligence and letting them know that how you can, and how when we're giving the news, and these are trusted journalists who do their research, and so we tell them, like, this is actually like trusted sources rather than your TikTok or like your Snapchat, because we did a survey recently with college students, and they said they receive all of their news through Snapchat. Now, again, I value our social media influencers, but again, I just want to, like, again, there has to be some sort of validity to some of that, and that's why we want to ensure to have them watch us, if anything. But
definitely. Yeah. I'm gonna age myself a little bit, but I don't get any of my news from Snapchat. So
I don't even have Snapchat, so I was just like, okay, cool. But then I was like, college students still watch Snapchat? I didn't even know it was still a thing. But yeah,
right.
Crazy. I don't know. I'm just old.
Well, thank you.
Yeah.
We'll move on to Bambi next. So Bambi, I see you over there. So the Latino community is diverse, it's beautiful, and complex. From the perspective as a trans Latinx leader, how has queer Latinx representation advanced civic engagement?
So I think it's important for us to recognize that storytelling is part of our culture, right? I mean, it has been mentioned, nuestras abuelitas and nuestros ancestros, how, they have been able to tell their stories, right? And for us, it's important for us to preserve those stories and for us to continue to uplift those stories in whatever way we can. But also storytelling, can come in many different forms, right? There's ways that we could do it through policy, for instance, right? Like, one of the things that we do as an organization is making sure that we actually record the experiences of our communities through different reports, right? Like, sort of like the same that you're all doing today, right? And these tools help us to influence policy, right? There's also other ways that you can capture people's stories to paint the picture, right? Through like audio stories, I'm also an academic, and so when I did my thesis, I use the testimonials theory, and really is to record the lives, the stories of individuals and transcribe those and really put them on paper, right? For them to be learned in academia, hopefully. So you can, find my thesis somewhere in there. But also, I think, again, having the stories documented, it's a way for all of us to influence the change that needs to happen, right? And we just need to make sure that we continue to do that so that we can actually continue to transform and change the culture that continues to oppress our communities.
Definitely. Thank you. Mm-hmm. And in addition to that, so we've seen you leveraging social media as well, and bringing your full authentic self. We've seen you at the White House. We've seen you with Governor Newsom. Why is it important that we fully represent Latinx experiences like that of trans Latinx folks?
Well, I guess for those of you who follow me, I mean, yo soy, I mean, no quiero decir que soy sinvergüenza, ¿verdad? Pero, but there's no shame in my game, right? Right? My personal experience as a trans woman, right? Like, it's one that has survived many different challenges, right? Homelessness, sex work as means to survive, incarceration, immigration detention, sexual assaults. I mean, you name it, right? Like violence in many different forms. And it's important that we, let the world know that that is the reality of our people, right? And also, as unfortunate as it sounds, it's the reality of many trans people, particularly young trans women, right? That, all the violence that we experience around the country and even here in California, right? Where people think that, we live in a progressive state, but, there are attempts to really erase our existence, right? Like denied access to healthcare, access to education, like in Los Angeles, there's like confrontations between extremist individuals and, members of our communities, trying to, mandate teachers and counselors to tell their parents if they assume that the person is, part of the LGBTQ community, and that's just an assumption, right? Like, and so there's many different things, right, that are happening. And so in my part, I use social media to not only tell my story as raw as it may be, but also, in some ways to uplift, members of our community. What I am using now, it's mostly telling people that you're beautiful, that you're amazing, that you're incredible, that you're, all of that, because I want for our community to not have to focus on the negativity of all, right? But rather just, give some type of hope to our people for us to continue to thrive in this world. Yeah. Thank you.
Thank you for that. Thank you for that, definitely. We can move on to Juan. So, speaking to you earlier this week, we know you're now an attorney. You work as an attorney, but you described yourself to me as a storyteller, and you used to do storytelling in different facets of your work. So I want to ask, in the current work that you're doing, Juan is working on cases dealing with street vendors. How do you implement storytelling and Latinx stories to do your work as an attorney?
Thank you. Yeah, that's a really good question, and it's something that I'm constantly asking myself, and something that I've studied as well. When I went to law school, when you're in law school, they're teaching you the objective person test, the rational person test. Sorry, and there are all these tests based on objectivity and the rational person test. And I was in law school classrooms where the syllabus said no personal narratives, and where stories were not allowed as a part of the classroom. And a lot of what was used and is used in academic scholarship, critical race theory, is the use of counter stories, the use of storytelling to be able to undermine what is assumed as natural, what that wiring of framework of power that the law has created as natural is just simply what stories we ascribe power to. And that, being able to break it down and use stories in that way is really important, because so much of the law in this country, as we all know, doesn't create the protections that workers need, the protections that farm workers need, the protections that domestic workers need. And so much of the work that I do is beyond the legal templates that are shared amongst lawyers. It's advocating and using stories to go further and actually do what the law isn't necessarily telling you can do, but using a story to push people further. I led the wage theft practice in my clinical pro bono program. And there's an issue of at-will employment in this country that was a drastic tragedy for workers, especially older workers during the pandemic that were laid off, like my dad, who had worked for a hotel for 33 years, his whole life. I grew up in those back hallways of the banquets room, and basically disposable. And so there are a lot of workers that were experiencing wage theft, and there are no legal hooks that you can come after a hotel for. And I had a number of clients that, because I understood my dad's story and what that meant emotionally, what that meant to my family's story, I was able to craft a story and a narrative in demand letters that I used and actually recover money from hotels in Boston for laying off workers without having a legal hook, simply by using a story and connecting the threat of litigation. And so I consider myself a storyteller with a threat now, and that's something that is important. It's important because we need more people to wield stories in this way, and it happens all the time. And I work in supporting street vendors now, and we worked on legalization, SB 946 and 972. There are so many narratives that are used against and wielded against street vendors, and public health narratives. One of the main pain points in a lot of the campaign work that we do is working with the Department of Public Health and the narratives that they're spinning, and what costs there are and the dangerousness of their food. And when we're not really considering health implications, and the real costs to government are cardiovascular issues, the real health problems are elsewhere, but we're assuming that street vendors create health problems and not understanding the way that they contribute to economic vitality, to safety, to helping women deal with childcare. A childcare shortage in LA is huge, especially, for example, wage theft issues. There are so many intersecting issues that are behind a street vending operation that people don't see. And so the narrative that's painted in the public eye is a story of dangerousness and foodborne illnesses, and under that pretension, we use an exorbitant amount of resources against street vendors when it should be the other way around.
Mm-hmm. Wow, give it up. Amazing work. That's really amazing work, and there's an opportunity for us as attorneys and then advocates to go out and make that systematic change, so that we can using narratives so that we can actually see change systematically. So thank you for that. And Belisa, we'll move on to you. So we can't talk about Latinx people in the media without talking about Latinx people in Hollywood. I kind of want to dig into this. You were recently in Blue Beetle, and is one of the first superhero movies with a full Latinx cast.
Felicidades.
Yes. Almost entirely Latinx cast, Latinx superhero, not a villain, and just superheroes always, they come from, sometimes they're underdogs, they come up with values, they protect their communities, so that's always been something that really calls to me about superhero movies, and even as an adult to see that reflected on the screen, to me, it made me a little emotional. I was very proud, very emotional seeing our stories being told. And you played a huge role in that film. So I want to ask you, what is it like being a young Latina actress in a role of this caliber? How does it feel? And do you ever feel pressure to be a representative in Hollywood from the Latinx community?
Yeah. Wait. Yes. Okay. Yeah. If you haven't already, go see Blue Beetle. Don't tell the union I said that, please. But yeah, so I think it's a really huge honor to have done mostly Latino-led projects in my career. I also did The Baker and the Beauty, which was a pretty much entirely Latino cast, yeah. But I just really appreciate being able to be a face for our community. I think I literally spent all my life, and my mom's sitting over there, she knows, I would go to her and be like, what, none of these people look like me. Like, I want to be an actor, but nobody looks like me. Like, how am I going to do it? She'd be like, no, America Ferrera. And I'd be like, yeah, I know. Yes, the one. But so it's an honor to be able to be in the group of, or in a time where there are so many of us coming to the screen, and to be able to do that for the younger generation, for, any kid at home who wants to be in the media and storytelling and seeing finally that our stories are there. They've always been, but they're finally being promoted and being pushed into the mainstream, and other people aside from our community are listening to us finally. And so it's truly such an honor to even be a part of that, to be a part of this time, such a monumental movie like our first superhero. That's awesome. And I always like to tell people, you know, the only white character in that film is the villain. Very proud of that. And there's also a total of 4 languages spoken in the film, which is not common for a superhero movie. And so, yeah, I think we have so much to be proud of. There is clearly so much more, like, so many more ways to go. But yeah, and I think the pressure can definitely be there. I think, as I was saying before, media and what you were saying about like where people get their news from, I will say a lot of it is from TikTok for me. Yeah, I have to admit that. I do. But that is why it is so important to have our faces out there, to have our faces being the ones talking about these policies that affect us. Because if it's not us saying it, why would my abuelita listen? Why would my cousin listen to that? You know, it's gonna be like, well, that's not for me, which has been so much of the stigma around health for Latinos in general. Is just like, oh, well, this isn't a my issue. This is a them issue. Like, this isn't for us. This space isn't for us. And so just by putting our stories out there for everyone to see, for ourselves to see, I think can completely change the way that, you know, we approach our own community, our own issues. And to say all that, yeah, knowing that I'm like a representative of that can be pretty scary. But yeah, I've got a room full of so many people that like I can look to for answers. And I think the biggest thing of me coming to this conference was truly just to listen and to learn, because I'm gonna take all this information and give it back to my community in ways that might be a bit more accessible for them. So yeah, I really appreciate being here, and you guys are helping me further, you know, by my education. So,
amazing.
Yes.
Beautiful, beautiful. And you have a very long career ahead of you, and we're really excited to see what other stories you can tell. Well, I'll do another question, a quick answer for all of us. You know, you were just talking about the ways that you're currently changing the narrative and where our careers are. How, in the future, how would you want to change the narrative, the Latinx narrative, further?
Ooh, that's a really big question. I think this might be controversial, but to the point where people see it and don't immediately be like, oh, that's a Latinx story. You know, like like right now we're, you know, fighting to get our National Museum of the American Latino on the presidential mall. And that's huge because the story of America and all these stories you see happening in the media, we're still there. Those are our stories just as much as we have our own. So I'd love for it to become a point where it's not like, yay, diversity. It's like, yes, there we go, there we are. Yeah.
Juan, we'll pass it in your direction.
Oh, I was hoping you would go skip me. I think echoing this sentiment and seeing universal stories being told in our contexts is important. Seeing joy, seeing fun. I want to see more fun stories that just treat us for who we are, for that charisma, for having the joy, the chispa, that sometimes it's always about the plight or connected to the plight, and not necessarily that there aren't like stupid rom-coms about us. There aren't like stupid high school coming of age stories. There are so many, like hundreds of thousands, if not so many stories about white people doing X, Y, Z thing that means blah, and we should have the same thing. And it should be something that we can always have.
I think for me is us celebrating one another. I think as not only my work at ABC10 and being one of the few Latinos there in that organization, but also as a small business owner and being a queer Latino-owned business, I found a lot of challenges, and I felt like some of those challenges came within our own community. And I'm just like, damn, y'all, like we gotta come up together. And so, and I would say, you know, I would love to see, yes, like it just be normalized. Like our stories are just normalized, and like, yes, I can relate to that. Love that for you. I'm gonna support you. I think that's what I hope to see, and it be more the processes are equitable. And I always will remember. A couple of quotes that some of my mentors say is, you know, nothing for us without us. And so when we're at those tables thinking about like, you know, how, like who's around, and if you're the only one, bring people along with you. And then, you know, I think I was reading, I think in the program, like, you know, we are bringing the folding chairs to the table here as well. And so just remind yourself of that, because I think we can get so stuck in the work that we want to step back. So hopefully, you know, that's what I
absolutely. I like that. And yeah. Yeah, especially in the news, right? Like you were saying, more of that representation, and then having more of that normalization. Maybe it's not just Latinx news, and then we have the ABCs of the world. Maybe, you know, we have news that kind of encompass all of us. So thank you for that. And Bambi, I'll pass it on to you.
Can you repeat the question?
Yes. So in the future, how would you want to change the narrative? What is the way that you want to change the narrative even further in your career?
Okay, so we're an action item for all of you. If you would, please follow us on our YouTube channel. One, we need to monetize, or we want to monetize from YouTube or Google or whoever. But in there we have, you know, different stories. You know, we have stories of, like we just posted a story of Lupita, who is our community specialist at our organization, who is the person who makes the food for, because we also give lunch every day for our community through our dropping space. And so, you know, there's many different stories that people can learn from, specifically about trans people, right? Like diverse trans people, people from El Salvador and Guatemala and mostly Mexico, pero I mean, it's because of LA, right? But that's why we are investing in our communications, right? In our communications team, because we have seen that funders, particularly in the private sector, right? They want to do like narrative work, but they contract like white-led organizations that they are supposed to be the experts, right? But we know that we're the experts of our own lives. And so, yeah, I mean, we want to make sure that our stories are told the way they need to be told. And that, you know, we continue to uplift the livelihood of our people through our stories. So that's what I would like to see in the future. But there's so much work that needs to happen. I think, you know, if we talk about the broader industry, right, I think there needs to be an intentional and meaningful investment in our people, right? So that we can see people, our people in the writer's room, that we can see people not just behind the cameras or catering to people. And I'm talking about the, you know, Hollywood industry, right? Or in the entertainment industry as a whole, right? Like we're not the only ones who are, you know, setting up the stage or, you know, all of those things, right? But that we are actually the ones who are creating the content that needs to be told. And the only way that that could happen, right, is when those executives, you know, are the ones, you know, white people are the ones who have the purse, right? And so how can we dig into the purse and get, you know, some coins out of the purse? Well, actually not coins, los billetes. Yeah. Right? Like, or hold the purse, right? Like, and walk with the purse, right? But there has to be an investment, right? Like yeah, we need to have studios to give us the purse so that we can, make sure that we bring our own people up as well, as you were talking about, right? So yeah, that's what I would like to see. And not just, trying to paint, así como tapar la herida con una curita, ¿verdad? But just rather, actually do something meaningful for our people.
Absolutely. Give it up for all our panelists, folks. Small but mighty panel. I'm hoping we have a little bit of time for some questions. We have a great panel. 5 minutes. Hey, we can get a couple questions in. All right, hands up. I see Xochitl.
Xochitl Castañeda, board member of this beautiful organization, the Latino Coalition for a Healthy California. What a beautiful panel. What a beautiful and important issue. And I like the way you put it because, words have content and content has some weight. It's not changing, but it's transforming the narratives, the great narratives. Narratives in media for me is like the perception you have, and we just pass or we are still at the end of a pandemic. And during the pandemic, our community, the Latino community, were mainly the essential workers, those who were at the front line, giving the services when everybody was in their houses, exposing. But we were not recognized. And I think we need to make a better effort in all the media to recognize the great contributions of this population, not just to our golden state that might not be so golden without the wonderful contribution of this 33% that you said we are the Latinos, but in general. So it's a big opportunity, and it's an opportunity also, I think, to fight to misinformation or information that is not correct. Again, during the pandemic, we saw that. We were not just fighting a pandemic, but also a pandemic of information and a great, that even came from our countries of origin. So I invite that you that are leaders on this, keep teaching us how to transform these narratives and elevate the Latinos as where we need to be. We need to be seen by this country and by the world and the role we have in this beautiful state of California. Gracias.
Thank you. Can I say something? Can I say something before the next question? Sorry, just really quick. I think it's important for us to recognize that there is an organized effort out there, right, that is led by extremist individuals that are essentially not only trying to keep us in the margins, but they are actually trying to eliminate our existence, right? Mm-hmm. And this is a well-funded movement, right, that is happening all over the place, all over the country, that se ha desinvergüenzado since, the Calabaza got into to be the president, right? And so, pues sí, ¿no? Parece una calabaza, ¿no? So, anyways, I think we're in a pivotal moment for us to really, understand one thing, that in 2026 is the 250th anniversary of the Constitution, right, or the independence, right? But how many of us are really independent in that way, right? And so I'm saying this because there is a movement that is building up, and that you will see that in 2026, there's going to be something drastic that is going to happen. So I invite you to be involved in some kind of way if you want to see our society transform, because we have to. or we have to think about, like, do we want to continue to be at the margins as they have kept us for 500 years, right? And so, so yeah, it's important for us to recognize that.
Do we have time for one more? One more. We'll do one more burning question for our media panel, Latinx in the media. I think you got one behind you.
Hi, my name is Melissa Rivera. I'm from the City of Pasadena's Public Health Department. I just came to check it out, and I'm very happy to see so many Latinos, because in my department, I'm like one of the few who speak Spanish. So I'm so happy to see you all. But on top of that, because I have to go back to Los Angeles soon, I just wanted to ask, what are your opinions on how many Latinos are being portrayed more Chicanos than Central Americans? Because I come from a Salvadorian family, and I hardly ever see myself on these social medias when it's Latino stories, because they're mainly Mexican or Chicano based. So I was just wondering your opinions and thoughts on that.
I will say that I think it's something that I've been noticing so much more. You know, I'm lucky that I am Chicana, so all those stories I am seeing that and being like, yes, that's me. But I know so many, you know, actors of Central American descent who have had to play these Chicano stories, and not that they don't, you know, feel amazing to be a Latina on screen representing any part of their community, but I can't imagine how, I don't know, not validating that would feel to keep seeing stories that say like, yes, Latina, this is our stories, and in reality it's a very small, you know, community story in a huge community. So you know, and I should have said that when we asked, you know, what are the ways that we can further diversity? I think that is a huge one. We've only touched the surface of our stories and what our stories really means. It's not, you know, the Mexican narrative or the Cuban narrative. There are so many of us that make up this community. And so, yeah, I just really wanted to say, like, I appreciate you for asking that, and I will do it in any way I can to make sure those more stories like that are being seen.
And I would say too, if you are in spaces where you feel like that clarification needs to be said, like say that. I think, you know, nobody knows what they don't know. And I think in our newsroom here, we've done a really great job at really trying to identify the intersectionalities of our storytelling partners to ensure that we are giving them the most utmost respect of who they are as individuals. And I think that's so funny you say that, because my husband is Hondureño, and if he gets identified as a Mexican one more time, he's gonna lose it. And I'm just like, babe, I'm like, yes, it's unfortunately it's nuestra raza too. They're like, Mexicano. He's like, I don't even look Mexican, but I'm like, okay. I think like sometimes, but for me, for a long time, I didn't even think about that. I'm just like, dang, like Latino, Latine, like Latinx, we are just comprised of so many different identities. And I think now in our newsroom, I think we've done a greater job of asking our storytelling partners, which are the people that we're telling stories about, is how do you identify culturally? So when we're telling those stories, we can be like, we're not just saying, oh, like a Latino community. We're specifically identifying, you know, Guatemaltecos or El Salvadoreños, you know, just to ensure we want to make sure, because I think sometimes we talk about this in our spaces, even in my friend spaces, that, you know, when we begin and this could be controversial, but I think when we start to clump a lot of people up, I think we start to lose like existence of who individuals' cultures are. And so it's just really being sure of, you know, like when you ask me who I am, I'll tell you I'm a queer Chicano man, like, and they're like, Chicano, what is that? And then I go into all of that stuff. But yes, and so I think just making sure, I mean, you own who you are and never be afraid of letting people know or correcting. I think like when people correct me all the time, I'm just like, I'm sorry, because my intentions were not to unidentify you, but I thank them, because then it just puts me back like, shit, I need to make sure I do better. And so, but thank you for that comment.
I think it's also important to, I'll say a couple of things. One is that it is the stereotype that has been built, about all of us, right? And also how that contributes to, in some ways, for us to be fighting with one another, right? Because that's the narrative that they have built. But I think it's also important to recognize that, other communities are also empowering themselves, right? And they are able to uplift their own stories. And so I want to say, we should, tell your own stories, and there's different ways, like some of nuestras compañeras who work at the organization, like se ponen, sus blusas de El Salvador, for instance, right? Like, and they do their videos and stuff, and without even saying that, that they're from El Salvador. But that's just a reflection, right? And so we should encourage people to be able to tell their own stories and realize and recognize that, people are also, doing their own thing.
Thank you for that. And so I think that's a common thread in all of these great panels that we've seen today, more representation. Latinos are diverse. We are not a monolith, whether that's in data, whether that's in policy, whether that's in the media. We need representation from Mexicanos, Central Americans, immigrants, undocumented folks, indigenous Mesoamericans. Every aspect of the Latinx community needs to continue being represented. And I think we're all a part of that. And everyone in this room is a part of that. So thank you all so much for watching this panel. Thank you for being a part of this panel, and I'll pass it back to our wonderful MC, Miriam.
Oh, follow Trans-Latina Coalition, if you will, please. Oh, la foto.
Of course, we need esa foto del recuerdo. Muy bien. Everyone's smiling. And since we were talking about media, I can't help but mention, of course, Telemundo, as a journalist for Telemundo. If you ever need any source of information, noticias, nos enfocamos noticias en español. Sin duda, siempre sintonizar Telemundo 33 or Telemundo Fresno. My little commercial there. Muchas gracias. Thank you so much. Thank you to all of the panelists. This is the final panel. Amazing. Now, we're almost running out of time, so I'm going to invite Dr. Cecia Aquino to share some closing words. Thank you so much, Doctor.
Thank you so much. I am so blown away by all the support, all the amazing conversations that we've had today. If we take a second to really think about every topic that we touched, right? How important that puzzle is, all the puzzle pieces that make up health equity, from data disaggregation to workforce development to mental health, and then changing the greater narrative. And I think many times we forget, right? When we're in public health and we're talking about all the specific details, we forget that these are stories that we're telling and that everything plays a very important piece in advancing health equity. I want to take a second right now to just recognize our amazing sponsors. This wouldn't have been possible without all your support. So if you are here and can take a stand, I will read out the names. We have Transform Health. Thank you. California Healthcare Foundation as our anniversary sponsor. Thank you for all your support. We have Ultimate, Defensor de Salud.
Thank you. We have HealthNet of California, our madrinas and padrinos. We have Ocean as our madrinas and padrinos. Do we have anyone? We have UCLA, LPPI, madrina y padrino. AARP, damas y chambelanes. We have Yuvo, damas y chambelanes. Thank you, Yuvo. Thank you. We have the David and Lucille Packard Foundation, damas y chambelanes. San Isidro Health, damas y chambelanes. Planned Parenthood, I see you in the house. CPAN, California Pan-Ethnic. Kaiser and CCF. Thank you all so much for your support. Honestly, we wouldn't be here without your support, your partnership, and we really appreciate how intentionally you're helping us pursue that health equity for our Latinx community. Now, up next, this year we are launching our Latinx Health Equity Champion Award. And our team got together to discuss. This was really a really hard process, just thinking through all of our amazing partners and the way that we work together to make this happen. Earlier, we talked about that unity, right? This work doesn't happen in silos. This work doesn't happen by one organization or one group doing something. This is really all of us working together to make this happen hand in hand. And we actually have 5 different awards, and I'll have my team join me up here to come and help me read out these names. And this is a surprise, so we'll see what happens in the room. All right, let me start. Over here, la doctora Lourdes Estelita Berniz Quinto. Can you come up here? Venga. Véngase para acá. Yes. Gracias. Muchísimas gracias por todo su trabajo. La queríamos reconocer como la doctora que usted es. Y muchas gracias por todo lo que hace por nuestra comunidad. Oh, una foto. Se vale.
And one more here. A las 3. 1, 2, 3. Perfecto. Okay, done. Done, Evo.
Up next, we have the amazing Fortina Hernandez. Yes. Felicitaciones. Thank you so much. Aquí está. Thank you so much for all your work. Fortina has been working with us for so long, and we just wanted to recognize all that amazing work.
Acá, 1, 2, 3. Perfecto.
Gracias. Muchísimas gracias.
Muy bien. Up next. So a couple of other folks couldn't join us in person, given traveling and a couple of illness issues. So we'll name them, and then we'll deliver this award. We have Ana Bolaños, who was here earlier from OHI, Office of Health Equity. Please join me in a round of applause. And we have MICOP as our partner organization who supported us very strongly this year with our SB 435 work. Please help me with a round.
last but not least, we wanted to recognize Senator Lina Gonzalez just for being such an amazing advocate, for helping move along that advocacy that needed to happen for data disaggregation and just being a partner in the work. She couldn't join us today, but we have the wonderful Kayla joining us. Should we take a picture? Thank you. We appreciate you all so much. Another round of applause. And with that, we are going to close for today. Thank you for bringing all the energy, all the excitement to all of our conversations, for being so dedicated. I know Mar gave you some homework earlier, so if you have those policy ideas, please turn in your forms. Like I shared earlier, this is how the work happens. So, yes, I am getting some flags over there. Oh, leave them on the table, we'll pick them up. Perfect, thank you for that. Up next, okay, so we've done the work, we work hard, but we gotta party harder, right? We gotta have some fun. We have our double quinceañera coming up next. Woo! Who is ready to party? Woo! We have Las Cafeteras joining us. We have a DJ Mari Fresh. We are just gonna party it up. We need to. We've been working hard. Now it's time to treat ourselves. So please join us. The instructions will come up on the screen, and we'll take a little bit of a break. So go home, freshen up, come with your quinceañera dress. We want to see you. And yes, we'll see you soon at Elk Tower. Oh, and there's one more announcement.
Thank you so much. Congratulations to everyone. Felicidades. And before everyone goes and starts freshen up, we have a special presentation from Senator Lina Gonzalez. We have some words from you.
Thank you. Thank you all for all the work that you do. I know the senator is sad she could not be here with you all, but on her behalf, I would like to give LCHC a certificate of recognition for all of their hard work, all of our partners this year, especially for SB 435. It was really a labor of love. I know with LCHC, Cecia and Mar and Johnny, we all really worked hard, and we will continue fighting next year. So thank you all for your work, and I hope you have a great rest of your day, and I would like to give this to you, Cecia.
Thank you so
Thank
much.
you.
Just stand right here. Yeah, right here.